So this is the beginning of our regularly scheduled council meeting for Thursday, October 8, 2020. Call to order. Madam Clerk.
Thank you, Mr. Chair, and good morning, everyone. We've been having electronic participation meetings for several months now, so I'm going to provide a shortened review of the protocols for electronic participation in this regular council meeting. This meeting is being streamed both live, audio and video, from the Region of Peel website. Some members are participating in this meeting electronically, and some members are present in chambers. In-person attendees will be identified at roll call. If participating electronically, for an optimum meeting experience, we ask that you please take the necessary measures to avoid feedback, interference, and confusion with members speaking over one another. The recommended WebEx meeting display view is active speaker, thumbnail video view, so you will have a full view of the presentation slides and other meeting materials. If you are experiencing a poor Wi-Fi connection, please disable your video. If you drop off the meeting, please rejoin, and if you have technical difficulties, please contact your local IT department for assistance first, following the same process as you do for your local council meetings. As required, your local IT department will reach out to regional IT staff for further assistance. Because of the nature of this hybrid meeting, and to ensure equitable participation for members attending both in person and electronically, the request to speak system in chambers will not be used. Instead, if you are attending in person and wish to speak, please raise your hand physically and you will be added to the speakers list. If you are participating electronically and wish to speak, please raise your hand by clicking on the hand icon located to the right of your name in the participant list. Members who connect to the meeting via the dial-in option can send an email to council@peelregion.ca and you will be added to the speakers list. Clerk staff will manage the speakers list and provide the chair with the names of members wishing to speak. If participating in chambers when called upon, please press the speak button to unmute your microphone and proceed. When you've concluded your comment or question, please mute your microphone by pressing the speak button again. If participating electronically when called upon, please unmute your microphone and proceed. When you've concluded your comment or question, please mute your microphone, lower your hand by pressing the blue hand icon to the right of your name in the participant list. Voting for this meeting will be conducted verbally. For procedural votes that do not require a recorded vote, the chair or I will call for any objections. If you have an objection, please unmute your microphone and indicate your name and objection. If no objections are stated, the motion will be deemed to be adopted. For recorded votes, I will call upon each member in alphabetical order based on last name. Once called upon, please unmute your microphone and indicate your yes or no vote. I will confirm the vote of each member. If you do not respond when called upon to vote, I will call your name a second time. If you do not respond to the second call, you will be recorded as abstaining from the vote, and your vote will count in the negative as a nay vote. If you are participating electronically and are leaving the meeting, please send an email to council@peelregion.ca to indicate that you're leaving the meeting. If you leave the meeting for any votes thereafter, you will be marked absent. We have 2 delegations on the agenda this morning. Delegates, when you are called upon, please unmute your microphone and begin your deputation. At the end of your presentation, please mute your microphone. If there are any questions, they will be directed through the chair. Please unmute your microphone to answer any questions and mute your microphone once you've completed your answer. We shall now commence the meeting with roll call. Mayor Brown?
Yes, I'm here.
Thank you. Councillor Carlson? Here. President Chambers, thank you. Mayor Crombie?
I'm here, thank you.
Thank you. Councillor Demerla?
Present.
Thank you. Councillor Dasco?
Hi, I'm here.
Thank you. Councillor Dillon?
Present.
Thank you. Councillor Downey? President Chambers, thank you. Councillor Fonseca?
Good morning. Yes, I'm here.
Thank you. Councillor Fortini?
Good morning, I'm here.
Thank you. Counselor Groves?
Good morning, I'm present.
Thank you. Counselor Innes?
Good morning, present.
Thank you. Counselor Kovac?
I'm here, thank you.
Thank you. Counselor Mahoney?
Good morning, present.
Thank you. Counselor McFadden?
I'm here. Good morning, everyone.
Thank you. Counselor Medeiros?
Here.
Thank you. Counselor Paleshi?
Good morning.
Thank you. Counselor Parrish? President Chambers, thank you. Counselor Raz?
Here, thank you.
Thank you. Counselor Sato? Counselor Sato? Counselor Santos? Counselor?
Hello, I'm here.
Oh, thank you. Counselor Sinclair?
Present.
Thank you. Counselor Starr?
Present.
Thank you. And Mayor Thompson advised that he won't be in attendance, but Counselor Early, are you here on his behalf?
Present.
Thank you. Counselor Vicente?
Present.
Thank you.
That concludes our roll call. I'm now on to the Indigenous Land Acknowledgement. We would like to begin by acknowledging that the land on which we gather and which the region of Peel operates is part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land. In particular, we acknowledge the territory of the Anishinaabeg, Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, the land that is home to the Métis, and most recently, the territory of the Mississaugas of the First Credit Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have this opportunity to work on this land, and by doing so, give our respect to its first inhabitants. Okay. First item that we have, approval of the minutes, September 24, 2020, that the minutes of September 24, 2020 Regional Council meeting be approved as moved by Councillors Starr and Sinclair. Is there anyone opposed? That is carried. Next, the minutes of October 1st, 2020. Motion that the minutes of the October 21, 2020 Council meeting, Regional Council meeting be approved for October 1st, moved by Councillor McFadden, seconded by Councillor Carlson. Is anybody in objection? That is carried. With that, I want to turn to the approval of the agenda. Councillor Medeiros, I believe I acknowledge you perhaps with an amendment to the agenda.
Thank you, Chair. No, I will be not adding any item today. Thank you.
Very good. Thank you. Anybody else with regards to the agenda? If not, then I need a motion for the approval of the agenda. I have a motion moved by Vicente and Councillor Demerla, that the agenda for the October 8, 2020 Regional Council meeting include an in-camera oral update regarding a local planning appeal tribunal hearing. And that is since struck. Be dealt with under in-camera matters 24.5. And further, that the agenda for the October 8, 2020 Regional Council meeting be approved as amended. All those in favor? Are there any opposed? That is carried. Which brings us to the consent agenda. We have item 7 under delegation and 8 that we'll be hearing. 8.4 I'll call out for. 8.4 with regards to if there is or isn't consent is the public disclosure of business with COVID-19 outbreaks. Consent? I have consent. Communication items 9.1, 9.2. All on consent. 10.1 is a staff presentation on our pest control subsidy, of course, so that'll be held. 11, items related to enterprise programs and services. Item 11.1, report of the Audit and Risk Committee. On consent. 11.2, Regional Accessibility Advisory Committee report. On consent. Communication 12.1, the letter from the Solicitor General Sylvia Jones.
Hold.
Asked to be held by
I actually just want it referred to the Deer Committee.
So very simply to be referred to the Deer Committee, and that's dealt with, Madam Clerk. Very good. Thank you, Councillor Downey. 13, items related to Public Works, Water and Wastewater Regulatory Compliance Programs. 13.1, do I have consent? On consent. 13.2, Public Works Education Programs. On consent. Communication items, none. 15, items related to health, Healthy Development Monitoring Map. 15.1, on consent. That is on consent. That brings me all the way down to the bylaws that we'll deal with at the time. In camera, 24.1 and 2 are minutes from previous meetings. Do I have consent for those? Very good. 24.3, closed session of the Audit Risk Committee, meeting held on September 17. Do I need that held, or can we have that on consent? Okay, and then the final item, I have 24.4, proposed property acquisition in the town of Caledon. Is that on consent?
Hold, Councillor Sinclair.
That is to be held, Councillor Sinclair. Thank you. Okay, very good. With that, Madam Clerk, over to you for a recorded vote on our consent agenda.
Thank you, Mr. Chair. I have a motion moved by Councillor Groves, seconded by Councillor Starr, that the following matters listed on the October 8th, 2020 Regional Council agenda be approved under the consent agenda items. And this does require a recorded vote. Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson. Councillor Carlson in favor. Mayor Crombie.
Yes, I support.
Mayor Crombie in favor. Councillor Demurla.
Yes.
Councillor Demurla in favor. Councillor Dasco.
Yes, in favor.
Councillor Dasco in favor. Councillor Dillon.
Support.
Councillor Dillon in favor. Councillor Downey.
In favor.
Councillor Downey in favor. Councillor Fonseca.
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini. Councillor Fortini in favor. Councillor Groves.
Yes.
Thank you, Councillor Fortini.
Yes.
Councillor Groves.
Yes, in favor.
Councillor Groves in favor. Councillor Innes.
Yes.
Councillor Innes in favor. Councillor Kovac.
In favor.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
In favor.
Councillor McFadden in favor. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Paleshi.
Yes, in favor.
Councillor Paleshi in favor. Councillor Parrish. Councillor Parrish in favor. Councillor Raz.
In favor.
Councillor Raz in favor. Councillor Sato.
Yes, and I apologize, I missed roll call, I was here.
Thank you. Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor.
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. And Councillor Early.
In favor.
Councillor Early in favor. Councillor Vicente.
Yes.
Councillor Vicente in favor. That carries. It's unanimous. Thank you.
Thank you. That brings us to delegations, and I want everybody to be aware that the chair was quite rightly reminded of our 5-minute time limit for delegations at policies and procedures this week, and I promised I will do better in that regard. So I remind our delegates we have a 5-minute limit for your presentation. We have two that are coming forward, and I think on a related item. Michelle Belak's here, and then Doug Kwan. Michelle with regards to the Canadian Alliance to End Homelessness, and then Doug Kwan, the co-executive director of Mississauga Community Legal Services, both on the same subject regarding community concern for the impact of Bill 184, Protecting Tenants and Strengthening Community Housing Act 2020, the end to the eviction moratorium in Ontario, and the impending increase in evictions in Peel related to related items 7.2, 8.3, and 9.2. Michelle, welcome. Oh, Councillor Parrish, did you have some? My apologies, Michelle. Councillor Parrish?
No, I just didn't want the delegates to think that we're just picking on them. You were also reminded that all of us are limited to 5 minutes and only speaking twice.
And that the chair should refrain from some editorializing as well.
Well, I
I
wasn't
learned the
gonna
lesson as well, so it relates to all of us. Councillor Parrish, thank you for making that clear. Michelle, welcome.
Good morning, Chair, and good morning, Council. Thank you for the opportunity to delegate this morning as a follow-up to our letter that was sent, also called Protecting Vulnerable Residents During a Global Pandemic, and it was sent in the beginning of September. Again, my name is Michelle Billick, and I'm the founder and co-chair of the Peel Alliance to End Homelessness, and also working for the Canadian Alliance to End Homelessness. And joining me today in our joint delegation is Doug Kwan from the Mississauga Community Legal Services. And we're here today as concerned community members and also as people who serve our most vulnerable community members. Can you put to the slide one, please? So as you know, Ontario Bill 184, Protecting Tenants and Strengthening Communities Housing Act 2020, received royal assent on July 21st, 2020, notwithstanding strong objections from tenants and tenant activists and advocates across the province. The primary concern regarding this bill is that it would create an additional pathway of evictions for landlords that would effectively circumvent the landlord-tenant board and also a person's ability to access free tenant duty counsel services. And then the individual will proceed directly to the sheriff to change the lock. The passing of this legislation in combination with the landlord-tenant board having to process already 590 eviction applications between March and June. And in addition, we've had the lifting of the suspension of the enforcement of the residential tenancy evictions in August. We believe that this will create a real tsunami, really, of tenancy evictions and displaced families throughout the region of Peel, as well as over the next few months as the eviction orders ramp up and because residents have no means to pay their rent or their rental arrears. We know that the region does have limited means to support people who are precariously housed, and we also know that those resources, including rent geared to housing, our shelter system, as well as the Housing Stabilization Fund, which provides financial support for tenants to preserve tenancies, has reached its limits. All of these resources were strained prior to the pandemic, and really were not equipped to address the forthcoming crisis that's coming our way in the region. In addition, we also know that we do have an affordable housing crisis here in Peel. We have one of the longest affordable housing waiting lists. And we know if people are evicted, they're really facing limited affordable housing options and a small market for adequate units for them to rent. It's also important for us to highlight that this crisis comes in the midst of a global pandemic. We're now in the second wave, where social distancing and staying home are key strategies to prevent the spread of COVID-19. And this region has consistently been in the top 3 health units of confirmed cases in Ontario. And the issue of displaced tenants should be of particular concern to all of you, especially since this crisis will only start to be felt in the next few months and in the winter months when the second wave takes stronghold and this pandemic continues through the cold months and when the cold weather sets in. Next slide, please. What we do know is that our region and municipality and our communities will most be affected by both Bill 184 and the end to the eviction moratorium, as well as the lack of financial support specifically for residential renters and landlords. Back in May, the Peel Poverty Reduction Strategy Committee sent a letter to our federal and provincial governments calling on support for residential tenancies and landlords, as they did for commercial properties. Unfortunately, though, no supports have been provided for local governments, for our residents, for their rent and arrears, and now they face evictions. What we will see is a variety of consequences that will greatly impact our community. We're going to see a rise of homelessness, including families and children. We're going to see a further burden on an already strained shelter system. We are going to see growing numbers of people seeking shelter in encampment settings. We are also going to see greater visibility of people experiencing homelessness in our downtown cores. We're also going to see a rise in the need for food banks, and of course, an immense fiscal strain on the programs and services that this region funds, including the Housing Stabilization Fund, which does provide fiscal support for people facing evictions. So what we need from this council is concrete actions and advocacy for supports for people facing evictions and preventing even more future evictions that also leave people and families homeless and on the cold streets. Doug, over to you.
Thank you, Michelle. And thank you through you, Mr. Chair. It's a pleasure again to hear before council. If I could have the next slide, please. So what we are seeking from the region is a call to the province to establish a balanced residential relief program similar to the federal emergency commercial rent assistance program. This will support small landlords so they do not feel the financial impact as a result of the pandemic, and it will provide stability for tenants living in this region. We also ask the region to, for the medical officer of health to declare evictions as a public health concern. We expect, as a result of the new legislation that the province passed in Bill 184, the lifting of the moratorium on evictions, and the second wave to result in many displaced households in the community. Those displaced households pose a direct risk of increasing the spread of COVID-19. We ask that the region consider joining the legal action to prevent Bill 184 from increasing evictions. That legal action has already, the City of Toronto has already taken steps to participate in that legal action, and we ask the region to join them. We also we also ask that the Peel Living and Peel RGI housing providers use traditional methods for evictions and avoid the fast track evictions that Bill 184 created. It does not, using traditional methods only means that tenants have an opportunity to appear before the Landlord and Tenant Board and have access to Tenant Duty Council. It is a very minimal financial risk for Peel Living and housing providers, but it would provide them with an opportunity to obtain legal advice as opposed to the fast or the new pathway for evictions that Bill 184 has created. We ask that the region send a letter to the province to reinstate the eviction moratorium. It made sense for the province to institute a moratorium back in the early days of the pandemic when our numbers were very high across the province, and we wanted, and the province recognized the fact that unemployment was at double-digit levels. We feel that we're back in that same situation again this fall, and possibly even in a worse situation. There are other actions that I would like to add that's not part of this specific slide. Specifically, the new pathway for evictions, as Michelle pointed out, is Section 206(3.1) of the Residential Tenancies Act. And we ask that the region highlight that specific provision and ask for that provision to be suspended during the course of the pandemic. That is Section 206(3.1). We also suggest that the region ask the province for increased funding to support the region's shelter programs, so the subsidized housing programs, the Housing Stabilization Fund, or otherwise known as the Rent Bank. Those programs are meant to support residents in this community, but they were never made to address the impact of a global pandemic. So we suggest that the region ask for more supports for those important programs. Especially, as I said, they weren't built to respond to a pandemic, and they were certainly not built to respond to new pathways of eviction that Bill 184 introduced. There are also other means to impact the private landlords through the Emergency Management Protection Act and Municipal Act. However, that is something that the region could consider as well. Next slide, please. Finally, what we see in the community is with the impact of Bill 184 and the lifting of the moratoriums, and with the pandemic, we see that the province has added more fuel to the fire. We agree with the staff report presented by regional staff that the combination of the lifting of the moratorium and Bill 184 will have significant impact on a segment of our residents who have already suffered disproportionately more during the pandemic than any other socioeconomic group. We also want to thank the Peel Poverty Reduction Committee, who provided a letter of support for today's presentation. Thank you, and we're open to any questions that the council might have of us.
Yes, and I have Councillor Demerla on the list, and she has a motion as well that she'll be speaking to. But Michelle and Doug, thank you for your ongoing vigilance and the voice that you put for the people that otherwise don't have the power to speak to this situation. So good on you, because I know you've been at this for years, and we commend you for your efforts on behalf of the less fortunate. Councillor Demerla.
Thank you, Chair, and I also want to thank Michelle and Doug for your presentation today. And, and Chair Unica will know this, Ward 7 probably has among the highest number of rental buildings in not just Mississauga, but I suspect the region of Peel. So this is an issue that's important for me and my ward. So thank you for highlighting it. And indeed, I do have a draft motion that addresses some of the asks that Doug, you made, particularly asking that the province once again consider putting a moratorium on evictions, given that the second wave is here. Homelessness is an issue. It's a big issue for me in Ward 7, and this would just add to that. And as well, I know that some of the changes that Bill 184 is bringing would put some pressure on the region of Peel in terms of our housing subsidy program. So the other ask, which I know I worked with staff and staff drafted that the province consider increasing funding to the region to deal with this. And so this is essentially an advocacy piece from you, the chair, as a letter to the province, highlighting these concerns and putting our support behind it. On the issue of the legal challenge, I understand that Toronto did do it, but their legal counsel had suggested that they had no standing in doing it. So I guess it was more a public relations exercise. And that's one of the reasons I didn't include it in my motion, but I'm open to hearing what my colleagues might say on that. With that, I look forward to support for my motion. Thank you, Chair.
Thank you. Councillor Santos.
Thank you, through you, Mr. Chair, and thank you, Councillor Demerlo, for bringing the motion forward. I'm happy to second the motion. Thank you also to Michelle and Doug for your presentation today and your continued advocacy for some of the most vulnerable in our region. The last council meeting, we had a series of delegations regarding the growing homelessness and mental health and addictions issues that have certainly escalated during COVID-19, particularly in downtown Brampton, as well as various encampment sites along the Etobicoke Creek Trail. We are already seeing the impacts of this issue and the lack of affordable housing, in addition to the pressures of COVID-19 and people not being able to pay their rent. So I share the same concerns that Councillor Demerla has, as well as the folks who have delegated today. I'm more than happy to second and ask full council support on this one. One thing that I will ask about the motion is if we could please also forward that communication to all of our local MPPs, as well as all of our local MPs. I know there's always a talk about a national housing strategy to go in place, but it's important, I think, particularly for all of our local MPPs in the region, to know that we are, as a region, advocating for this issue. Thank you, Councillor Demerla, and thank you, Michelle and Doug.
Thank you. Councillor Parrish.
Yes, I too am really happy to support the motion. Thank you to Councillor Demerla and Santos. One of the saddest things I see occasionally, I'm a little bit of an addict to CNN, given the current political situation down there. And every once in a while, they'll feature a family that's been thrown out of their apartment. And there was one with a young man holding a baby, and the wife had the stroller filled with their worldly possessions. And when asked, they said, well, we have to leave our furniture. We can't take it anywhere. Where are you going? We have no place to go. So these are really sad days, and I support it.
Thank you. With that, I have a mover of the motion, Councillor Demerla, seconded by Councillor Santos, and it's so important that I think I'm going to read it for the benefit of our delegates as well. Whereas the province of Ontario is currently experiencing a sharp increase in the number of COVID-19 cases, indicating the onset of a second wave of the pandemic, and whereas it is uncertain when an effective vaccine will be broadly available for COVID-19 and when public health measures can be relaxed to allow for a return to normalcy, and whereas tenants have experienced unprecedented job losses and loss of income due to continued challenges as a result of the COVID-19 crisis. And whereas housing stability is a critical tool to manage the pandemic, as acknowledged by the implementation of a moratorium on most eviction proceedings from March 19, 2020 to July 31st, 2020. And whereas the provincial government had put a freeze on all evictions but has since rolled back, and it is now legal for landlords to once again evict tenants. And whereas the Region Appeal is expecting an increased demand on client services such as increased rent, homelessness, shelter visits, overflow costs, applications to Housing Stability Fund, amongst others. Therefore, be it resolved that the Regional Chair, on behalf of Regional Council, advocate to the Premier of Ontario and the Minister of Municipal Affairs and Housing to request that the provincial government immediately restrict all residential rental evictions, except in the case of threat to public safety, and maintain this moratorium on evictions until COVID-19 pandemic is effectively contained. And further, that the provincial government be requested to immediately provide additional funding as requested through the Social Services Relief Fund to support the Region Appeal's eviction prevention program and offset the costs of the provincially mandated rent freeze. You have heard the motion. Madam Clerk, over to you for the vote.
Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson? Yes. Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demurla?
Yes, thank you.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey? Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini?
In favor.
Councillor Fortini in favor. Councillor Groves?
Yes, in favor. Thank you.
Councillor Groves in favor. Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
In favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes, support.
Councillor Paleshi in favor. Councillor Parrish? Councillor Parrish in favor. Councillor Raz? Councillor Raz? Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes, with gratitude.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. And Councillor Early?
In favor.
Councillor Early in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor, and it's unanimous.
That carries unanimously, and I was remiss in not including the last clause that read, and further, that this resolution be sent to all MPs and MPPs. So that's part of our resolution as well. The second thing I need to do administratively is at this time move receipt of Delegations 7172 and 83, and I know we also dealt with 9-2 at that time. So a motion to deal with those from Councillor Parrish and Councillor Carlson. All those in favor? Any opposed? None. The last comment that I would have, and perhaps I've just missed it, but I know that Eileen Baird wrote an absolutely marvelous briefing on this that was addressed to the Strategic Housing and Homelessness Committee that I read late last night. I don't know if it's part of the broader report, but this is just outstanding in speaking to all of the issues that we've discussed, whether it forms part of the body of the letter that I'm going to send in addition to this resolution. I want to know that people read this and understand, because it speaks to the issue so well, so it was well done. I don't know if it's formally to be received by council as a whole, but I want this spread far and wide. That's the point that I'm coming to, because I know it reads here that it was just a briefing for the Strategic Housing and Homelessness Committee, but I think all of council would be interested because it just encapsulates it beautifully. So whatever need be done, that everybody and our delegates and deputants be made aware that this is before us. Okay, so I've taken the vote. I still have a list. Councillor Groves?
Thank you, Mr. Chair. I just wanted to comment on just the correspondence from Aileen, and I agree with you. It was very well written, very well done, and I think that that should accompany your letter, Mr. Chair.
Thank you, and it will be redrafted accordingly in such a format. Thank you very much.
Perfect.
Okay,
Thank you.
with that, the last thing very quickly, I can't pass up on these opportunities to remind Michelle and Doug, and I think you're well aware, short-term housing accommodation rents, I understand a big issue, But when my day comes, my epitaph as chair of the Region of Peel will read, the proudest feather in our hat is the $1 billion we've devoted to housing over the next 10 years, where this council's put $330 million in for affordable housing. The federal government stepped up with their $260 million. I can only assume they're writing the check at Queen's Park now for a $1 billion initiative that this council had the courage to lead and spearhead and put our money where our mouth was, and will be in the whole community. We're going to be building for the next decade and addressing that part of the housing continuum as well. And as I say, it's our proudest moment as a regional council. So I never let an opportunity pass with reminding everyone the great work that this council has done on that file and reminding our friends from the province that we're still waiting for their check. Thank you very much. Thank you very much to our delegates. Okay, moving on. We're on item 8, COVID-19 related matters. 8.1, an update on the Region of Peel's response to COVID, a presentation from Dr. Lawrence Lowe. Lawrence. Lawrence, I see you muted. Are you there? Go ahead.
I'm sorry, my computer froze. I apologize, Mr. Chair. But thank you very much, Mr. Chair, members of council. I will aim to provide my remarks and also try to keep them brief in recognizing the extent of the agenda today. But thank you very much, council, for the opportunity to speak to our current status of COVID-19 in the Region of Peel. I'm going to touch on our current picture. I'm going to touch on a bit around testing, specifically changes and impacts. I'm going to touch on contact tracing, and I'm also going to talk on additional recommendations at this time that I would propose in order to keep our in order to keep COVID-19 under control in our country. So first of all, our current picture in Peel, not surprisingly, mirrors our community's form and interactions. At this time, our major drivers continue to be, firstly, household transmission and gatherings, and this is because we have more homes with more occupants in the Region of Peel. Secondly, we continue to see transmission in workplaces, and typically, because of the nature of our employment profile, these are not usually in the public-facing workplaces, but more in large, non-public-facing workplaces where, if precautions aren't being taken, workers are finding crowded conditions that might lead to spread. And finally, we are seeing a lot of transmission in social gatherings, and this is a wide range and gamut, everything from small in-home gatherings to weddings. We are seeing very large weddings and exposures in those settings, in banquet halls and event venues, and also smaller in-home gatherings, dinners, coffees, etc. And basically what's happening is there is a cycle that continues to keep our case rates high in the Region of Peel. And basically that cycle is from workplaces, someone brings it home and they bring it to a social gathering, and then someone there brings it to a workplace or wherever. So it's basically these three settings that really mirror our community's form, our people's employment profiles and their interactions. And so that really speaks to the story that we see. Long story short, we are seeing high rates of transmission in known chains, in general, in known exposures. But it means that we are at risk because these can break out at any time into the wider community if we're not careful, and then most concerningly from the wider community into vulnerable settings. So ideally, what I'd like to see is for us to try to cut our daily case counts down in half. Right now we're at the higher end of the range we had planned for. We're at the 100 person range. I'd like to see that cut down to 50. And we know that that will not happen through testing and contact tracing alone, because testing and contact tracing is what happens after the horse has left the barn to prevent it from getting further out. But really, we need people to be taking precautions more seriously. And based on our data, there are additional recommendations in the picture that I've just described, which I will touch on. I wanted to talk about two aspects of testing. First of all, recalling that testing is a provincial mandate under Ontario Health, which is a provincial agency. We continue to work with them and advise them based on our community picture. As you know, there is a large provincial backlog of COVID-19 cases that is being cleared very quickly. And as it is cleared quickly in the weeks to come, I just want to advise council that you may see more erratic shifts and swings in our daily case counts as that gets cleared out. At this time, 60% of results on tests are coming back in 2 days. So there are a lot of tests that we haven't gotten results back for yet. Now, that said, fortunately, because many of our transmission is occurring within known chains, many of the results we're waiting for are people who are already isolating because they've presumptively either been sick or whatever the case might be and linked with a known case. So there is that general awareness, but I want to be very clear that as the backlog gets cleared quickly, a lot more test results are going to come in giant data dumps. And so you may see larger than usual case numbers here to there on isolated days that reflect that data backlog being cleared. But from a risk perspective, as I've said, we've been contact tracing, and because of that, many of the people who are waiting for test results, they've either been contacted or they're in the process of being contacted. And so hopefully that will continue to keep our numbers and our pictures under control. I wanted to talk a little bit about wastewater testing. So as you know, in early 2020, research discovered that you could actually track the COVID-19 virus through wastewater. It's important for me to state here that it doesn't spread through water, but rather it's an opportunity for us to detect genetic material of COVID-19, which is being shed in the feces of individual to identify where activity might be high. And so since April, Public Works and Public Health staff have been working with analysts and researchers from the University of Waterloo, and we've been tracking the levels of COVID-19 water at the GE Booth and Clarkson wastewater treatment facilities. And we have been able to detect COVID-19 in our wastewater. The trend of the amount of virus found in the wastewater is similar to the trend that we saw through the first wave and into the stage 3 reopening. However, of course, we need further time to look at that data around water testing. At this time, that limits our ability to predict the number of individuals and the activity we're seeing in the community. But we will be continuing this pilot through the end of 2020, and we will also be sharing this data from this project with the Canadian COVID-19 Wastewater Coalition and the provincial command table to request additional funding to continue COVID-19 virus wastewater testing in Peel to make sure that we can figure out how to use this as another tool to monitor activity in our community. The last thing I wanted to touch on before I get to the recommendations of my update is contact tracing. I know that there's been a lot of questions, especially with recent announcements in other jurisdictions around the nature of contact tracing. And I want to reassure Council that we continue to contact trace every positive COVID-19 case. This is an absolutely critical function, and this is a bread and butter public health function to stop spread. We've been doing it pretty much since we got our first case on March 5th and have been ready to do so since we entered emergency operations in January with all the persons under investigation that initially came in the winter months at the beginning of this year. And to date, we have traced over 10,000 COVID-19 cases in the region of Peel, which is a significant number, particularly considering that many of those cases, at least in the last little while, have become incredibly complex with lots of people not adhering to precautions and having many close contacts. So we're really grateful, though, that many people who have been waiting on test results have already been doing their part and have been self-isolating to protect others. We are interviewing those people, finding out who and where they spent time with, and deciding who among those contacts is at highest risk of being infected. And then we prioritize those high-risk individuals and contact them to advise them to self-isolate just in case they're incubating. So this is essential work that we have done. We continue to do so to break chains of infection. And we don't typically contact people at low risk who are at low risk of becoming infected out of the contact list. Certainly, we would love to prioritize everyone being contacted, but we know that Peel residents want us to focus on the spread of the disc, and that is why we have always focused as much as we can on the people at the highest risk, the contacts at the highest risk, and that was where we've seen success in bringing the first wave under control and continue to keep things under control in our community. So that is where we are with contact tracing, with testing, both in terms of the backlog and wastewater and our picture in Peel. At this time, I've issued a number of recommendations. Firstly, of course, continuing the core 4 of distancing, masking, washing hands, and staying home if sick. Practically, what this means is it's all about limiting close contacts between individuals. And so I really have to reiterate that with our picture in Peel, we continue to see high rates of transmission that could burst out into the wider community at any time, which is why we need everyone to take this seriously. So at this time, I am recommending that residents start to reduce their close contacts to their immediate household and essential supports only. Essential supports are typically defined as someone who you might rely on for daily physical or mental well-being, such as a caregiver, a childcare provider, or emotional supports if you are living alone. For all other interactions in person, I encourage our residents to stick to the most essential in-person interactions. So work, school, healthcare, buying food, drink, gas, and also automobile maintenance. Really, what we're trying to encourage is, limiting the number of excursions we do have, and for the excursions that we do have, can we ensure that numbers are being kept down, and can we also ensure that precautions are always being followed if it's not someone in your immediate household and essential support circle? I think that's where we really need to go in terms of our community to make sure that we are limiting any possibility of our high transmission spreading further. We also continue to pursue an isolation center to help with household spread, and we have an application in with the federal government for funding. And we also continue to work with workplaces and the Ministry of Labor to put in proactive controls and also inspect proactively, especially in the high-risk workplaces that we've seen transmission in, to make sure that we're trying to bring those under control. And you've also received my letter to David Williams, where I've advocated for a lower consistent gathering limit applied across settings, the closure of banquet halls and event venues with provided financial support by the province, and also, as I mentioned, the proactive inspection blitzes in high-risk workplaces. So that's a little snapshot of where we are in Peel. I'm happy to take questions at this point in time, and also, Mr. Chair, recognizing that Report 8.4 in respective disclosure is also on the agenda, happy to field questions on that report as well. Thank you, and I'll pass it back to you.
And thank you. My list is Mayor Crombie, Groves, DeMarilla. Mayor Crombie.
Thank you, Mr. Chair, and thank you, Dr. Lowe, for that update. Hope everyone can hear me. As we know, our transmissions are different than in Toronto. We don't have restaurants, bars, pubs, gyms, etc. We see still the community transmission, as you described, households, workplaces, etc. The averages are starting to creep up between 60 and 100 per week in Peel and 46 last week in Mississauga. So obviously we're all concerned, and want to thank you for the Thanksgiving message to everyone, which includes just immediate family and essential support individuals. So let's keep Thanksgiving tight in the hopes that we can celebrate Diwali and Christmas and Kwanzaa and Hanukkah all together again. Just wanted you to comment on further contact tracing and whether we can get the resources we need to focus on more contact tracing. There seems to be a shift in Toronto or at the province away from more in-depth contact tracing, and that's an area I think we need to dedicate some resources. Maybe there are some available at the federal government. I thought Minister Haiju, when you and I both spoke with her, was offering more assistance with contact tracing. So that's my big question. And then, of course, we're all being asked of not only for the Thanksgiving message, but what's the message to the kids at Halloween? That's the next set of guidelines we'll have to issue. So if you could respond to those two, I appreciate it. Thank you, Dr. Lowe.
Thank you so much, Madam Mayor, and through you, Mr. Chair. So in respect of contact tracing, we continue to train and redeploy numerous staff within the Public Health Unit. We have also started working with Public Health Ontario, who use those federal resources that we were speaking to assist with contact tracing. So we've started sending a number of contacts to the provincial level. We have also previously received assistance from other health units, Wellington, Dufferin, Guelph, and Niagara, although with their cases also starting to rise, that assistance is now becoming more infrequent. But overall, contact tracing, as I mentioned, we continue to focus on high-risk contacts that are identified through our initial case management. Certainly we'll continue to try to bring on board and ensure that as many contact tracers are supporting our work. We are also on a hiring blitz, I should mention as well, and that position has been posted, and we're currently recruiting there. But I will have a more fulsome answer around some additional potential resourcing asks around contact tracing and our ongoing pandemic response that will come forward in a council report later on this fall that also reviews the end of the first wave. So I'll keep you all posted on that. In respect of Thanksgiving and Halloween, Thank you very much. I actually neglected to notice there, and final bullet point there on Thanksgiving. So Thanksgiving is one of those events that I think celebrations we should really rethink. You know, is this the time to be getting together? And to the extent possible, I would encourage everyone to celebrate Thanksgiving this year with their household and immediate supports. So thank you, Mayor Crombie, for reinforcing that message. And then through the chair to Mayor Crombie around Halloween, there was guidance received early this Monday from our provincial partners. We understand that guidance is now being under review again, but we do recognize that Halloween, if anything, is probably one of the more unique celebrations that our community has, if you think about how it's celebrated. And I'm committed to getting guidance out to our residents and families as quickly as possible so that they can make some decisions and plans, particularly if an alternative means of celebrating Halloween needs to be considered. Thank you.
Thank you. Councillor Groves.
Thank you, Mr. Chair, and thank you, Dr. Lowe. I just have a quick question for you, Dr. Lowe. With regards to dance studios, we're not quite sure what they're classified under. It's a little confusing. Are they an arts? Are they classified under arts? Are they classified under sports? Because there seems to be some mixed messages from, say, York Region. York Region is allowing them. They're under arts. I believe City of Brampton and City of Mississauga is also allowing them, and they're under arts. But our dance studios here in Bolton, they're not quite sure, and I don't have an answer for them. So I wonder if you can provide some clarity on that.
So thank you, Councillor Gross, for the question through you, Mr. Chair. I actually wouldn't have any specific answer to this question right now, but I'm happy to look into it and certainly report back to you, Councillor Groves. I do wonder, Patrick, if the legal solicitor would be able to comment on how the statute would view a dance studio, whether it's an art or a gym facility.
Like you, Dr. Lowe, I would want to look into it, and perhaps two of us together could put our heads together and get back to Councillor Groves on that.
Okay, thanks very much.
Thank you.
Thank you, Councillor Demerla.
Thank you, Chair, and thank you, Dr. Lowe. Very reassuring to hear that in Peel we are continuing to do contact tracing. So just to confirm, because in the media we are reading that there's no contact tracing being done through restaurants and other public places of gathering. So I wanted to confirm that in Peel, though, we are continuing to do that. So if you could just clarify that. And then on the test results, I have a family member who got tested for COVID not this week Monday, but a week ago Monday, so about 10 days ago, and is still waiting for the result. He got tested in Etobicoke. So I'm just curious what's going on with the testing, why it's taking so long to get results, and reading a lot in the media as well about how Ontario is somewhat unprepared for the testing, and wanted to get your sense, because you're in the trenches, as to what the reasons are. I mean, we had a pretty good idea that there might be a second wave in the fall. So just trying to understand what those limitations are.
Yeah, thank you, Councillor Demerla, for the question, through you, Mr. Chair. So in respect of contact tracing in restaurants and bars, so the way contact tracing works in general is that when someone tests positive, we essentially try to identify where they may have had an exposure. We also try to identify who they may have come into close contact with. So it's very dependent on a case-by-case basis. So if there's someone that works in a restaurant or bars, or may have been at a restaurant or bar while they were there during their infectious period, we would try to ascertain more who might have been exposed or who they might have been with, et cetera. And then depending on the nature of the exposure, we would then either reach out to contacts that they may have exposed there, or if we're unable to identify all contacts in a setting like a restaurant or bar, or identify a broader public exposure, then we would move to issue a public disclosure. That's kind of how it would work, and where restaurants and bars, as with any other setting in the community, would fit into our contact tracing. In respect of, and again, with a focus on whether it was a high-risk exposure, that would then require broader notification of contact. And so then again, with respect to test results, again, recognizing, of course, that I am not the person who is mandated in respect of operating the testing system. And I do know that we've worked with our Ontario Health partners and they have seen numerous challenges. I don't think it was the second wave that drove a lot of the testing demand, but it was the previous criteria for testing that permitted asymptomatic, low-risk people who hadn't had exposures to get tested if they needed to. That resulted, especially with the start of school again, in a significant demand for testing that the system then attempted, I believe, has attempted to correct through new provincial criteria around who can get tested, which I think from a public health perspective is very helpful because we haven't seen much in the way of random testing of well individuals. A lot of our testing, a lot of our help for contact tracing has really come from tests that are done on people who have been exposed or who have symptoms, and then really being able to act on that information, as well as people who are part of a high-risk group, which is kind of where the province's criteria are. So I know that our provincial partners at Ontario Health are certainly working diligently to clear the backlog that has arisen. And I imagine with the new criteria in place, we will be able to make sure that those who need to get tested and then get a result back in a timely manner that allow us to do contact tracing and that allow them to take precautions and isolate. So thank you very much for the question.
So just as a follow-up, what is the lead time right now? I know you said that we're going to catch up, but right now, if you get tested in Peel, how long does it take to get the result? Because I'm just seeing this through a personal experience that it's been 10 days since the test and no result yet.
Yeah, absolutely. Thank you for the question, Councillor Durant, through you, Mr. Chair. As mentioned, our provincial partners are having significant challenges with the testing system. And so the best data that we have right now in terms of when tests are being reported to us, over the last week, over the week of September 22nd through September 28th, 21% of tests done on Peel residents were coming back within 24 hours, and 58% were being reported within 2 days. These are both under the required benchmarks that the province has set for 90% within those timeframes. And so, you know, I share your concern, Councillor Demerla, but I do know that our partners at Ontario Health are trying to get that testing and trying to get things back to residents, and then also to us in public health as quickly as possible to make sure that we're keeping things under control.
Okay, thank you, Councillor Raz.
Thank you very much, Mr. Chair, and thank you for your update, Dr. Lowe. I do, if the chair will allow me, I do want to briefly speak to 8.4 in a minute. I know it went on consent, but I'll revisit that because it's all related. When it comes to the app, the COVID app, it's how can we, as a region, encourage younger people to download it onto their phones? I think most kids from, age 10 and up now have it or have phones. So how can we get the younger people to download it? And also, what are we doing to engage workplaces to also do it system-wide within their workplaces? Because the more people that use this, the more effective it will be.
So thank you for the question, Councillor Raz, and through you, Mr. Chair. Certainly when it comes to people, youth, children, I would encourage parents, especially if they're between 10 and 14 or 10 and 15, if they're in school, certainly to download the app for them. I think that's certainly something that they can do, and so that messaging has generally gone out to parents, I believe, from our provincial and federal partners, and we certainly can reinforce that and continue to reinforce that here at Peel. I think for young folks as a whole, it's just the ongoing marketing and targeting of that age group through provincial messages to encourage the app being downloaded. I think mentioning it at every opportunity, mentioning it in social media, and that also goes to some extent, Councillor Raz, around some of the other messages that we're delivering, for example, on Thanksgiving, et cetera. We certainly welcome the help of Regional Council to push those messages out on various platforms, and especially ones that younger adults might use. That is certainly helpful. And in respect to workplaces, the app is actually included, I believe, in a lot of our workplace guidance as something that is recommended, and that's in addition to the rest of the precautions that workplaces should absolutely be taking. So absolutely agree with you, Councillor Raz, that it's an important tool and that everyone should have it on their phone because it provides an additional layer of protection in the event that an exposure does occur and you've been in proximity with someone else who also has the app who has entered their result into the phone. And I think that was that the only part?
Yeah, that was the question.
Okay.
When it comes to flu shots, I had a question from a resident earlier this week. They're in the more vulnerable population of being a senior who's immunocompromised. For flu shots, are there going to be any opportunities for drive-through or walk-through flu shot clinics?
Thank you, Councillor Raz, and through you, Mr. Chair. At this time, we have secured more traditional flu shot facilities, and those will be taking place in Brampton and Mississauga I believe, at 10 Peel and also at Fairview Clinic. We've also recently secured some space in Caledon, and I'll get the location. We'll send the location out to an updated council shortly. And those are all currently designed as traditional flu clinics with COVID precautions put in place. Certainly a lot of the other modalities that you describe, Councillor Raj, are things that are also being actively discussed, and to the extent possible, especially to protect vulnerable populations, I think we would try our best to offer some nature of that service if we're able, depending on what our discussions come up with.
Yeah, I guess for some pharmacies, those who might offer COVID testing, if you're in for your flu shot to stay protected, you don't want to be standing, next to somebody who's in for a COVID test. So those are the challenges that we never thought we'd have to deal with, but they're our new reality. When it comes to the public disclosure of business, it was interesting to note that the Toronto Board of Health recently passed a motion to request their medical officer of health to implement a system that's more, open and transparent to workplace and public outbreaks. I'm just wondering, are we working in tandem with Toronto Public Health to make sure that, because I know that Toronto, Peel, and Ottawa continue to be, the hot spots. So I just want to make sure we're working in tandem with those other jurisdictions that have higher count.
Yes, absolutely. So through you, Mr. Chair, and to Councillor Raz, first of all, if I could just respond to the point on Shoppers Drug Mart. In fact, people who are symptomatic with COVID should not be getting tested at the pharmacy. They should be going to the assessment center. And the pharmacy testing is actually, as I understand it from our provincial partners, directed at those as part of a targeted testing initiative, individuals who are higher risk by virtue of their work or by virtue of being connected to a long-term care home, et cetera. So these are typically asymptomatic, well people who may not have had an exposure to COVID-19, which helps to reduce the risk a bit more in the pharmacy setting. But I wanted to make sure that the community knew that if you have symptoms consistent with COVID-19, or if you're asymptomatic but have been exposed to COVID-19, the place that you should be getting tested is at the assessment center, not at pharmacies. Absolutely. And in respect of the disclosure, yes, we are in close contact with Toronto. I think really when it comes down to the disclosures, part of the challenge, as council can appreciate, is that there has been a lot of interest in where and how this is happening, and we do have the data, but the data needs to be crunched, analyzed, and verified. And our epidemiologists and analysts, understandably, for a large part, and especially as our case counts climb, their focus has been on getting that data crunched for the response and actually directly speaking of the response, as opposed to broader public reporting. But we do recognize the public interest, especially in talking about things in more aggregate about kinds of workplaces or the size of workplace outbreaks in certain sectors. And so we are having all kinds of conversations at this point in time with Toronto around how that might look, and ideally would align whatever we come up with to the extent possible with Toronto, and certainly with Ottawa as well.
Okay, thank you very much for that. And last point, the epidemiology reports that get sent out every Friday are amazing for people who like the data. The recent one on the contact tracing, that was a really good visual of of what Peel health officials do to try to do that, I thought was very useful, and sent it out to a few of my residents who like the details. So I would encourage other regional councillors to share that particular document with the public, because there are people who do like to get into those details. But thank you very much, Dr. Lowe, and I appreciate all your efforts.
Thank you. And there was an additional follow-up point. The acting CAO had something with regards to the COVID alert app. Nancy?
Yes, thank you. And through the chair, in regards to that question, I just wanted to share with Council that effective early next week, we will be pushing that app to all of our regional devices. Now, it will need to be activated by staff for privacy reasons, but that's also something we will encourage them to do. So along with their online screening tool, they will also have that app, and we hope that's another opportunity to spread the news.
Thank you. My list going forward is Peleshi, Downey, Sato. Councillor Peleshi.
Thank you, Mr. Chair. Thanks, Dr. Lowe, for your update. Just a couple questions, Doctor, around testing. Recently, the province had shut down the newly testing facility in Brampton, Greenbrier, which puts us down to, I guess, back to 3. The one at South Fletcher's, Peel Integrated, I think, is still operational, and then Brampton Civic, I think, is operational with a head nod. Yes, or there isn't.
I think there's 2.
Okay, so Peel Integrated and South Fletcher's are the 2 that are operational if you have symptoms. But you can go to pharmacies in Brampton if you do not have symptoms. So a couple questions. You were talking about the data dumps and the possibility of them, I guess, skewing the numbers a little bit. Is there an opportunity for, when we're publishing the numbers, that we can separate those numbers with any of the newer numbers? That way it's not saying we've, I think it was 100 and some odd cases yesterday. It's not actually 100 cases yesterday. It's maybe 50 cases yesterday and then 50 from previous. Can we separate the two to get more accurate numbers?
So through the chair to Councillor Peleshi, the best place to actually do this is it's already separated by report date and by symptom onset date. And so if you actually go to our dashboard at peelregion.ca/coronavirus.
I'm on it right now.
Yeah. So the yellow bars at the bottom are,
yes, I see those.
Yeah, those are a reflection of when the illness started based on the symptom date that was there. So that actually provides a clearer, that actually provides a more accurate picture of what we're seeing, or at least what is being reported day to day, as opposed to the report date, which is where we get, it could be like one day we get like a whole whack of cases.
Right.
So the curves that you're seeing on the yellow bars, those more closely resemble what we're seeing, and you can see how that has actually largely stayed consistent pretty much since the second week of September, with a few bumps here and there, but still in the same average range over the last 4 weeks.
Okay, so and I respect that and thank you, but that's not what people are seeing. The public is seeing, the social media posts by the 3 mayors mainly, because those are the ones that I really see. Thank you, Mayor Crombie, Mayor Brown, and Mayor Thompson. But I just wonder about then those numbers and the numbers that we're putting out at the region, the numbers that the media is taking. So it's not accurate. So if we could have those discussions just to see if we can separate them somehow, would be great.
If I may respond through the chair. So absolutely, Councillor Peleshi, I think it's something that our team can definitely look at, because we also have an interest in making sure the public knows what's due to a backlog and what's due to actual cases reported, recently reported cases. So I'll take that back with my team. Absolutely. Okay,
great. Have we reached out to the pharmacies to see what the timelines are? I have not heard really anything to see if there's a tremendous backlog. Are we in communication with them?
So through the chair to Councillor Peleshi, I'm happy to take that question to Ontario Health Central Region and to ask. My understanding was that because the pharmacies have just started testing, they don't have much on turnaround times because they haven't had any tests coming back yet, right? So, so the data is probably still coming in. I anticipate they would be impacted somewhat by the backlog because ultimately all the swabs go into the same system. But I can take that back to Ontario Health Central Region and provide it in an update to council later on.
Thank you. Final two questions. The school outbreaks in the report. What is classified as an outbreak in a school? How many people?
Thank you for the question, Councillor Fleshy. And so through you, Mr. Chair. So in general, it's based on the provincial outbreak guidance. And so you're looking at cases, and then you're looking within cohorts, whether there's an outbreak in a cohort, and then you're looking at an outbreak in a school. And so, a broader school outbreak usually would be a number of classes with linkages between those classes, and and there's no other potential area of transmission other than the school, based on our investigation. And so that's usually where it is. It's the hierarchy between there's a case in a school, which could have been acquired elsewhere, to potential outbreak in a cohort where at least one case has passed it on to another case and they're in the same cohort, and then transmission between cohorts is where we would look at an outbreak in a school.
Okay, so if there was a child or a teacher that was tested positive for COVID, and another child or teacher tested positive for COVID in that same school, would that be considered then the outbreak? The start of an outbreak?
So through you, Mr. Chair, to Councillor Plesh.
Dr. Lowe, if you can hear me, you've frozen up. And I think we've now lost everyone's video, so we're aware of it and trying to work to resolve that.
It's something that occurred in the school.
Sure. Really quickly, Mr. Chair, I know you're probably being pushed by somebody, but really quickly, because I think it's really important, Mr. Chair, that if there's a case in the schools are really listening to you, Dr. Lowe, Peel Public Health. And I think it's very important that parents know that when there is a case or multiple cases in the school, as fast as possible. So I think that's important. I will leave that with you. The last comment I will make, and I'm hoping to help Councillor Groves with this, as my girls go to cheer, they're in a private gym, and they're allowed to operate. So I think it depends if it's public or private. Councillor Groves, I hope that helps. Thank you, Mr. Lowe. Thank you, Mr. Chair.
Thank you. Councillor Downey.
Thank you, through you, Chair, to Dr. Lowe. I'm just wondering if you can go back to the water testing and give some clarification as to the why and how we approach that situation, and what that data ultimately is used for in terms of securing public safety.
So thank you for the opportunity, Councillor Downey. And I do, through you, Mr. Chair, I do have a briefing note that I will send to council after council, along with some of the updates that have been requested. I'm happy to share that. But basically, in respect to wastewater surveillance, it's been used historically to detect viruses and bacteria such as poliovirus and other antimicrobial resistant organisms, to really have a bit of an early warning system to see if there's an outbreak or something along those lines that might be happening. It's been used with great success to detect outbreaks earlier on elsewhere in the world, notably, I believe, at the University of Arizona. And at this time, we've been essentially doing a pilot of the testing to see if we can also similarly detect COVID-19 and collect data compared to our trends to figure out how we would use it ideally in a predictive manner in the future. So that's why this was undertaken, and we are continuing to crunch the numbers and analyze things, and hopefully it will become another tool in our arsenal in controlling spread in our community.
Thank you.
Thank you. Councillor Sato.
Yes, thank you, Mr. Chair, and thank you, Dr. Lowe. And just before I ask my questions, a big thank you to you and your staff for doing such an outstanding job. It probably didn't realize when you took over this position, what you were going to be facing for the last 7-8 months now. Hard to believe. So a couple of questions. I'll ask the school one first. I know we were advertising, and you may not know this, but we were advertising for more public health staff And my understanding was that that was so we could provide more staffing to the schools. Have we been able to support the schools with staff in the schools as we were trying to?
Thank you for the question, Councillor Sato, and for the kind words and support. Certainly, it has been an unusual year. But so through you, Mr. Chair, I'm just seeing if Paul Sharma is on the line because he was our director and lead in respect of our school nurse hiring program, and perhaps he could provide us with an update as to where the hiring is and what has transpired with the nurses. Paul, are you there?
Maybe not. Well, maybe he can. Maybe we can get it at the end of my questions then, or at some other
I'm
time.
happy to, yes, absolutely.
Yeah, just an update. So, with regard to the flu vaccine, the actual flu vaccine, I've been hearing from my residents, the more vulnerable ones, which I guess are seniors, that they are getting the high dose, which I think is the double dose vaccine. But what they're reporting is that the pharmacies have been running out of it. And so some posted she just got hers and then they ran out after her. So what is the situation with that?
So absolutely, thank you for the question, Councillor Sato, through you, Mr. Chair. I want to make very clear that demand for flu vaccine and ensuring adequate supply is a challenge not only in COVID-19, but is also a typical challenge throughout the flu season. As you know, we get all of our flu vaccine, through specific shipments that come from the Ontario Government Pharmacy, and then those are distributed as best they can to meet demand. But all that to say, I know that as far as I know, the provincial government is sending us more doses this year. I think that's been announced, and we are going to be aiming to try to get those out as quickly as possible once they are received on our end. But this is certainly not a new challenge. It's one we're aware of, and certainly if there are any questions or concerns in respect of that, folks can either follow up with us at Peel Public Health 905-799-7700, or more specifically, we just continue to wait because we are continuing to distribute them as quickly as we receive it at this point in time.
Okay, and I know she said that the pharmacy, which is in my ward, was taking bookings for the high dose vaccine. I don't know if they were taking it for the regular flu vaccine, but could you have staff send us some information that we can post for residents, because there seems to be a lot of confusion around it. I mean, I didn't know what the answers were to it. If we could have something very simple to tell residents, about getting the vaccine, where they go, who they contact, etc. So the other question is, if someone, as we're heading into flu season, how are people going to know whether they have contracted a regular flu or COVID?
So thank you, Councillor Sato, and through you, Mr. Chair. First of all, to the point around communications. So yes, we do put together a communications campaign every year, and that will be done again this year, and certainly materials will come out. Usually we align our launch of our communications campaign with the launch of the provincial communications campaign, because the province, as you know, undertaking the universal influenza immunization program typically likes to centralize and coordinate the messaging around flu. So as with previous years, we will ensure that we get all those materials out when we're able. In respect of whether it's flu or COVID-19, my recommendations goes back to the core 4 behaviors in the midst of a pandemic. And the fourth one is, if you're sick, make sure that you stay home and get assessed and determine whether you need testing. So I wouldn't leave it to people to figure out whether they have flu or COVID-19. I think if you've got symptoms, you should be self-isolating, possibly seeking medical care, and also possibly attending at an assessment center to rule out COVID-19.
Okay. And the third one on the flu, these are questions residents are asking me.
Oh, no worries.
If they contract the regular flu, are they more at a higher risk of COVID if they have exposure?
So through you, Mr. Chair, and to you, Councillor Sato, I would imagine anything that makes someone sick at least would render them somewhat vulnerable. But I think the most important thing is to make sure that we're actually trying to take precautions to prevent it in the first instance, which includes, at least with flu, taking one's flu shot, and with COVID, the core 4 behaviors. So I think the best thing to do is to make sure that you get a flu shot, and that you don't have to you take the precautions so you don't have to find out whether COVID and flu can coexist, for sure.
Okay, good. And just in response to Nancy's information on the region pushing the app on the phones, the city has done that as well. And so all of the city staff phones will automatically have the app. I found that, and I don't know, maybe I didn't set up the app properly, but my husband gets a weekly report pushed to his app. And I don't get anything unless I go into the app. Is it something to do with the way you set it up? And I was rather confused about it. And I'm pretty savvy on on things like on things like this. But the app says you need a number. Do you need the number to get the weekly reports, or do you only need the number if you want to report that you're exposed?
Sorry, Councillor Sato, I apologize. I may have missed the last part of the question there. Your image froze briefly.
Oh, okay, sorry. So my question was, on the app, there was a list somewhere on the app. It said apply for a number, which I did not do because I thought you only needed a number if you had been exposed and wanted to share the information. So I just found that very confusing, and I'm sure others do as well that may not understand technology, and I think I'm pretty savvy on it. So,
through you, Mr. Chair, and to you, Councillor Sato, let me look into that because I actually haven't looked that closely at my app since I downloaded it, but I'll look into that and I'll be happy to send you a response.
Okay, thank you, because I tried some Google searches and questions and nothing was coming up with the answers. It just kept referring me to the provincial website, which didn't answer the questions at all. So,
if I may through the chair to Councillor Sato, if it's possible to send me a screenshot of what you're seeing, I can actually send that to the provincial service.
Okay, I'll do that. Okay.
Yeah, that's perfect.
And again, thank you very much.
Thank you,
Thank you. Councillor Demerla. Councillor Demerla? It may have been a holdover. I'll go to Councillor Parrish, then I'll double back. Councillor Parrish?
Yes, Dr. Lowe, there are some people who have bad reactions to the flu shots. Are you the least bit concerned that they're in a weakened state for a little bit and probably shouldn't get them this year, or are you suggesting they still go ahead?
Sorry, so through you, Mr. Chair, to Councillor Parrish, just if I could clarify what sort of reactions are you
Slight
referring
fever, sore arm, feeling tired. It's not me. I never get the flu shot. I will this year.
Fair enough. So through you, Mr. Chair, no, those specific side effects are not a reason to not get the flu shot this year. I would still recommend. Certainly, people may have mild fever or a sore arm or a rash, etc. Those wouldn't. I don't think those would render anyone vulnerable to COVID, and I don't think those would be reasons to defer the flu shot, especially in this year in the midst of a pandemic. Our recommendation would still be to take some Tylenol and get the flu shot. Yeah.
Thank you. When COVID first hit, I had just received a prescription for the new super shingles inoculation. I had the old one and obviously didn't get shingles, but there's a new one for seniors. And my doctor handed it to me, and I said, "What about the COVID stuff?" And she took it right back. Is that also something that you would agree with or not?
So through you, Mr. Chair, to Councillor Parrish, I wouldn't know why that would have happened. In general, I'd have to look a bit closer at the shingles vaccine specifically, but as I understand, that wouldn't be a contraindication to receiving the shingles vaccine at this point in time. So I can double check that and get back, but that's not a contraindication that I'm aware of.
Okay, thank you. And my last question, Wellfort was prepared to start doing testing in Malton, which is a high incidence area. And I guess the labs can't keep up with the sites that are already open. Any chance we are getting close to letting Wellfort help Malton, because they're pretty isolated up there?
So through you, Mr. Chair, and to Councillor Parrish, we did receive this request from your office, and we have raised it numerous times with our Ontario Health Central Region partners, and will continue to do so.
Thank you very much. Thank you.
Thank you, Councillor Demerla.
Sorry, Chair, my hand's just up from before.
Mayor Crombie.
The same. I apologize. I never took it down. I forgot.
Okay, and Councillor Paleshi.
Thank you, Mr. Chair. Dr. Lowe, yesterday they closed the South Fletcher's testing facility and then reopened it today for winterizing. When I was testing there not too long ago, and I've heard others since, what I find there is once you're inside the tent, it's left up to the nurse and doctor to kind of facilitate where the cars are moving, when to move, and not. I was also concerned about the exhaust coming from the vehicles. I know they're asking to shut the cars off, but I was wondering if we could look into the possibility of having maybe one of our own staff from Public Works, or I can take this to the municipality to maybe help facilitate the cars in and out, and then also provide the exhaust pipes to pipe cars to the outside. Maybe that would help also move along the process if possible. Can I leave that with you, and maybe you can just send me a quick note on it?
So through the chair, I thank you, Councillor Paleshi, for the question. That's not that wouldn't really be in my wheelhouse. I don't know if that's a question Commissioner Farr might be able to speak to, or in terms of traffic flow, I believe the police have been involved previously. But Commissioner Farr, are you able to speak to the exhaust pipe piece?
Or perhaps Catherine can speak to it here. She's waving at me. Go ahead, Catherine.
Thank you, through you, Mr. Chair. We can take that consideration back. Councillor Paleshi, thank you for that suggestion, and we'll let you know.
Excellent. Thank you. Thank you, Mr. Chair.
Thank you.
Okay, everyone, that exhausts my list, and staff are advising me we're having some technical difficulties because I'm told email is down across the region. And we're also having difficulties with Wi-Fi. Our technical folks are working furtively to try to sort it out. What I'm going to suggest, given that we've got one big item left on the agenda, is I'm going to call for a break for the next 15 minutes to recoup at 12 noon sharp for the last major item on our agenda. That'll give the technical staff a chance to sort that out, and maybe a bio break and a quick bite. So see you all in exactly 15 minutes at noon.
Mr. Chair, if it helps, I just heard that the live stream is back up.
Very good. Okay, working towards it, and we're getting there. As I say, just a short recess. We'll see you all in 15 minutes. Thank you. Okay, everyone, as promised, here we are at 12 o'clock promptly, and with thanks for the break and the furtive work the technical staff have done behind the scenes, I understand we're more or less fully up and running again. So we're back in session, which brings me to the next report related to COVID-19 matters. COVID-19 Planning and Recovery in Long-Term Care, a presentation by Susan Griffin-Thomas, Interim Director of Long-Term Care. Susan.
Thank you, and good afternoon, Mr. Chair and members of Council. I will provide for you today an update on the Region of Peel's long-term care COVID-19 response. Next slide, please. Since March, there have been many changes within our 5 regional long-term care homes. As the pandemic continues, strategies such as working in one healthcare facility, cohorting of staff, daily screening, and increased infection prevention and control measures that were implemented in response to COVID-19 have become part of our new normal in long-term care. This new normal has also required us to be flexible and agile in response to constant changing conditions within our homes and our community in response to provincial directives and surveillance testing results. Next slide. During this pandemic, quality improvement efforts have continued as new strategies are implemented to respond to the changing needs in long-term care. With significant staffing changes and pressures, our manual scheduling process was very resource-intensive. Thanks to Council's approval, new scheduling software implementation is underway and will be in place by November. As well, with the increased use and need for personal protective equipment, we have made improvements to our processes for tracking, communicating, and educating our staff and essential caregivers. We also have agreements in place with our local hospitals to provide virtual medical and nursing care to our residents when an in-person visit is not possible. A family inquiry line was established to provide families with timely responses to their emails and phone calls. Since mid-April, staff have responded to over 500 inquiries. And we have developed processes to establish supportive care units to cohort and isolate COVID-19 positive residents when needed. Next slide, please. As we all know, COVID-19 has had major impacts in long-term care, particularly to residents and staff. Long-term care homes are considered to be an outbreak if one staff or resident tests positive for COVID-19. When homes are in outbreak and for the safety of residents, residents are isolated in their rooms and visitors are restricted. This has led to increased loneliness, isolation, and fear for our residents who are no longer able to see their loved ones, and when they are able to, everyone is masked. As a result, this pandemic has negatively impacted the health of our residents. We have had increases in falls, worsening depression symptoms, and unplanned weight loss. While we continue to provide care with a butterfly lens, this is becoming more challenging during the pandemic as there are staffing challenges. Communal dining is replaced by tray service in individual rooms, residents are unable to freely engage with others, and families have to follow infection prevention and control measures to ensure residents are kept safe. There is also fear and anxiety amongst our staff related to their increased risk of COVID-19, childcare needs, schools reopening, and ongoing staff surveillance testing twice a month. The ministry directive that mandates staff work at one healthcare location has created increased stress related to precarious work since 30% of our staff are employed part-time. These increased pressures from the pandemic has resulted in staff burnout from working long hours and multiple shifts, as well as trauma for caring for beloved residents who have passed away from COVID-19 and caring for family members at home. Next slide. Throughout this pandemic, we have been applying the best available evidence, lessons learned, and following the advice of public health. Collaboration with Peel Public Health, the Regional Emergency Operations Center, and the Integrated Response Table have been tremendous support to long-term care in our COVID response. In order to mitigate the impacts of COVID-19, we are continuing with enhanced infection prevention and control measures. Should an outbreak occur, staffing challenges remain a risk. Ensuring there are enough staff members to cover all necessary shifts while maintaining resident and staff cohorting has been difficult. Additionally, the emergency orders of healthcare workers working in only one location has increased job insecurity for frontline staff. Better job security and less precarious work for our part-time staff will help to protect the safety of our residents. Our ongoing twice-monthly staff surveillance testing has been critical for identifying COVID-19 cases in our homes. With all that is happening in long-term care, it is imperative that we identify and prevent compassion fatigue and burnout in our staff. We will continue to prioritize staff wellness and ongoing support. Lastly, regular communication with our staff, residents, and families has been essential in providing updates on the changing situations. Next slide. In preparing for the second wave, our long-term care homes completed preparedness assessments for Ontario Health in August. Ontario Health has categorized all of long-term care in Ontario homes based on level of risk and has developed support plans based on this level of risk. We are still waiting to hear how our homes performed on this assessment. We have continued with human resources planning as regional redeployed staff have returned to their base positions as regional services have reopened. Without hiring additional staff, cohorting practices are not possible, and longer shift patterns will continue to be required, resulting in continued overtime. Resident engagement will need to be reduced, which will result in worsening health outcomes, and we won't have the resources to support infection prevention and control measures and personal protective equipment logistics. This pandemic has compounded existing human resource issues in long-term care, and additional supports are needed. We are also developing COVID-19 surge capacity plans to proactively identify each home's response and action plans depending on the level of COVID-19 outbreak. Finally, continued advocacy to the province is needed for sustainable long-term funding. On September 29th, the province announced plans to invest $540 million in Ontario's 626 long-term care homes to help protect from future waves of COVID-19. As well, the province just announced last Thursday temporary wage enhancements of $3 an hour for personal support workers in long-term care and community care until March of 2021. While these funds are very much appreciated, we need to continue to advocate for sustainable long-term care funding for the sector and the long-standing issues that this pandemic has exacerbated. Next slide. Our next normal is a balance, monitoring and preparing for the ongoing risk of COVID-19 for our residents and staff while ensuring their safety and well-being. We will continue to adapt and respond to the ever-changing requirements of this pandemic. This includes additional measures, restrictions, and staffing during COVID outbreaks, in addition to our new normal in our 24/7 long-term care operations. Trying to find this balance has highlighted the pressure points in long-term care, particularly relating to the staffing model and precarious employment. While we have implemented creative solutions, we must continue human resource planning for the pandemic and ongoing operational needs. Next slide. We are so grateful for the exemplary care our staff provide our residents as we deliver our mandate of improving quality of life for those living with us in our long-term care homes. They are truly healthcare heroes. Thank you for the opportunity to present to you today and for your support of long-term care in the region of Peel.
Susan, thank you very much. Questions at this time? Councillor Paleshi. Councillor Paleshi, did you have a question? I'll go to Councillor Downey now and maybe double back. Councillor Downey.
Thank you to you, Chair. Thank you for the presentation. I don't have any questions, but just a thank you to yourself and your entire team as well. I think I recognize some faces despite the masks in that last slide. I think one of them was my neighbor. But I just wanted to, again, say thank you to all of you, and I'd be happy to move the report recommendation at the appropriate time.
Thank you. Last call, Councillor Paleshi. If not, we've had it moved by Councillor Downey. Madam Clerk, over to you.
Thank you. Motion moved by Councillor Downey and seconded by Councillor Carlson that the staffing strategy, as outlined in the report from the Acting Commissioner of Health Services titled COVID-19, Planning and Recovery in Long-Term Care, be approved. And further, that the funding related to the adoption of the staffing strategy using a combination of COVID-19 related and other external funding be approved. And further, that the Region of Peel continue to advocate to the province to ensure that appropriate funding is provided to address long-standing system pressures in its long-term care homes. And this does require a recorded vote. Mayor Brown? Mayor Brown? Councillor Carlson? Yes. Councillor Carlson in favor. Mayor Crombie?
I support.
Mayor Crombie in favor. Councillor?
Yeah, okay. I'll talk to you after.
Councillor Demerla? Councillor Demerla? Councillor Dasco?
Yes, support.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini?
In favor.
Councillor Fortini in favor. Councillor Groves?
Yes, in favor.
Councillor Groves in favor. Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
Yes, in favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes, in favor. Happy to second as well.
Thank you. Councillor Paleshi in favor. Councillor Parrish? Yes. Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor?
Councillor Sinclair in favor. Councillor Starr?
In favor?
Councillor Starr in favor. And Councillor Early?
In favor.
Councillor Early in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor, and it carries. Thank you.
Thank you. Thank you all. Okay, that brings us down to staff presentations. Item 10.1, Pest Control Subsidy Framework and Study. We have a presentation from Dr. Nicholas Brandon, Associate Medical Officer of Health, Anthony Parente, Acting General Manager, and Bobby Corden, PhD Urban Rodentologist. I don't know if Commissioner Farr or Anthony would like to kick us off.
Thank you, Mr. Chair. Dr. Brandon is going to kick us off.
Dr. Brandon, please proceed.
Thank you. And through the chair, thank you for the opportunity to present to Council today. I'll begin the presentation by providing the public health context. Next slide, please. Rats are part of the urban ecosystem in Peel region and our environment. Public health does receive complaints about rats from all parts of the region. For the time period of 2017 to 2020, Peel Health received 330 rat-related complaints, including 150 in Brampton, 10 in Caledon, and 170 in Mississauga. The number of complaints that we received varied from year to year. Next slide, please. This map shows the rat complaints reported to Peel Public Health by postal code areas and the call volumes for that 3-year period. Overall, the volume of calls is low given our size and population. The number of calls shown do not necessarily reflect the rat populations in each area, but a system like integrated pest management would allow us to monitor and determine the real number of rat populations for these areas. Next slide, please. In terms of illnesses, the rates of reportable rat-borne diseases in Peel are low. There haven't been any cases of plague in people in Canada since 1939. There haven't been any reported cases of rodent-associated diseases, including types of viral hemorrhagic fever, hantavirus pulmonary syndrome, which is a rodent-borne viral disease, or tularemia in the past 10 years in Ontario. Although rats can carry bacteria like E. coli or Salmonella that do cause gastrointestinal illnesses, none of the reported cases in Peel region that we have were linked to exposure to rats. Next slide, please. With respect to rats, public health is responsible for the inspection of food premises, like restaurants, and the enforcement of food regulations. Public health will respond to rat complaints on private property, where they inspect the premises and look for evidence of rats, like droppings or burrows, and they provide education and advice to the property owners or occupants while they're there, as well as potentially further surrounding properties if they're involved. Public health will refer to property services or bylaw if needed. Next slide, please. This slide is busy, but it's showing the various roles of the region of Peel, area municipalities, and owners and landlords with respect to rats. The current mandate and scope is outlined on this slide, and it's similar to what's occurring in other regional municipalities. The current responsibility for pest control lies with the property owner. From this slide, public health will act if there's a risk to the health of the community, such as a significant risk of disease transmission, or for the enforcement of specific public health-related legislation. Otherwise, public health would refer the matter to the local municipalities. I will turn the presentation over to Anthony Parente for the next slide, please.
Thank you, Dr. Brandon. I will now walk Council through a brief summary of the external municipal scan, which was completed by staff and our consultants. Staff and our consultants found that most large municipalities in the Greater Toronto Area did not have rebate programs in place, although most had website education and recommendations for residents. While we found many rebate programs in some smaller municipalities, particularly in southwestern Ontario, staff note that all but one are for residential customers only and specifically exclude ICI, that being business and institutional. The primary reason we noted this is that many businesses, particularly the food industry, have specific requirements to have pest control programs in place, as mentioned by Dr. Brandon. Staff also note that at least one municipality canceled its subsidy programs due to excessive cost. Where rebate programs exist, staff complete inspections to ensure residents meet the criteria to receive a study. This usually involves ensuring there is no presence of food, waste, and/or other property standard-related issues. The inspection also provides an opportunity to provide data for monitoring programs, as well as education about overall pest control measures the residents can take. Next slide, please. This is a summary table of the municipal scan data, and I apologize, it is busy. A more detailed version is available in Appendix 4 of the report. For the monetary amount, most programs were found to endorse a subsidy amount of 50% of the actual cost incurred for professional pest control services to a $200 limit per year. As noted, most programs require residents to meet criteria to qualify for the subsidy. After qualifying, residents must use a vendor approved by the municipality. Many of these programs are new and have only been in place for approximately 2 years. Windsor's program is actually the most established at 20 years. A key point here is that staff note that where there was a subsidy in place without a strategy to address rodent and other pest issues, there was increased overall cost for a subsidy program. So what should a strategy encompass? Next slide, please. Staff note that key to overall program success is the implementation of a control strategy that uses the IPM process. So what is IPM? Integrated Pest Management, or IPM, is a method of pest control that neither relies solely on pesticides nor discourages them altogether. The overall goal of IPM is to keep pest levels at threshold levels where they pose minimal risk to people, property, and the environment. To do this, IPM focuses on a detailed understanding of how pests grow and develop, with a particular focus on what determines survival and causes outbreaks. There are 5 basic steps in the IPM program, and they are inspection and monitoring, pest identification, establishing an action threshold, implementing control measures that are environmentally compatible and economically feasible, and then evaluating their effectiveness by monitoring record keeping. In summary, IPM is a decision-making process that anticipates and prevents pest activity and infestation by combining several tactics to achieve long-term solutions. I'm now going to turn this over to Dr. Bobby Corrigan. Bobby is a rodentologist with expert in urban rodent control. Bobby's suggestions were instrumental in the data before you here today. Bobby.
Thank you, Anthony. Thank you for the honor to present to the Peel Region Council. As you can see with the next slide, my life, quite honestly, I'm a scientist who works with rats, and specifically rats and mice in cities. You know, some mammalogists study whales and some study wolves. I've dedicated my lives to the study of rodents and how they interact with us and populations in our cities. I should mention I have other cities I work with, in some cases, some very large cities like the City of New York, Department of Health, Rodent Control Division. I think everyone knows New York City is one of the premier retropolises, perhaps in the United States, but the rats are well distributed everywhere. Next slide. So I'm just briefly, of course, time is limited. I just want to mention a couple of very quick points about the Peel public health complaints that Dr. Brandon just mentioned, a little bit of a consultant's perspective. Also, I want to provide some comments on the recommended program for the Region of Peel with the long-term vision in mind and making sure, you know, we have a solid program going forth. Talk about the rebate program, and from a scientific aspect, what's really important to have a quality rebate program that Anthony was just discussing. And just to end, I'm not going to repeat the IPM components, but how important it is whenever you take on rats in the environment, you are in the environment. And so we want to do that, as Anthony just emphasized, in a way that is not going to go backwards in the environment and damage the environment. So next slide. If I could, and so here, just quickly, this is not a biology lesson on rats and what have you, but this is the animal we're discussing here. This is the Norway rat or the brown rat. This is the rat that is predominant throughout North America and many parts of the world. This is the Noi rat, and this is the rat in Peel, right? And this is a painting by John James Audubon. It's quite beautiful, and so it's an animal that in many ways is beautiful, but we'd rather it stay in its own world and not get into ours. So we do not want it around our buildings. It has the potential, even though it's slow, as Dr. Brandon mentioned, we don't want this animal in our houses, in our basements, in our shops or schools or what have you. So, but it is out there as a wild mammal, like many other wild mammals. Next. I took this picture in a suburban backyard, and the reason I did, and the reason I'm presenting it is this is the common scenario. Rats have learned over the years to stay close to human beings. By staying close to human beings, we drop food, we spill food, we store food, whether going all the way back to, cave peoples, that rats learned if I move in the cave with the cave peoples, it's warmer in here. They have food left out from their dinners of whatever that was in the cave, and I can hide in between their belongings and so forth and so on. It's the same exact thing in modern day right now. They hang out close to us, waiting for us to drop food, store food, be sloppy with our food, and you can see these suburban rats right here in the yard just locating food that was left out in this environment. They scavenge about, just like squirrels scavenge about for acorns. So that's common. I would like to mention here, Peel Region's not alone in all of a sudden being concerned about rats. As a consultant, I travel around the world working on rats in cities, and I will tell you the rat populations are up around the world. And in some cities, I've been in the past 3 years, the city councils and the mayors and everybody is meeting, and they, just like we are here, and they're asking, why all of a sudden are we seeing rats in our cities in dramatic numbers? Right, so this is something that's a global in scale, and we're not going to go into all the scientific reasons, but Peel is not alone in this aspect. Next, the comments. There's only 2 comments I'd like to make to the public health complaints, the sightings. These are sightings, and as Dr. Brandon just mentioned, you'll see the different colors. Red, deepest red, being the highest number of complaints. But for Peel Region, right now, those numbers relatively, as Dr. Brandon mentioned, are low, and they're very low, in fact. I see a lot of complaint data and 311 data from around the United States, and I have many cities that I study their data and look for trends and so forth. So the good news is the number of complaints are low. The more important point, however, which I would like to state, is that it's important that Peel Region is addressing this while those numbers are low. That's the critical factor, and as a outsider, if you will, I applaud Peel Region for doing this, because with rats, you have to start early so it never does become large numbers into the hundreds and hundreds and even the thousands. New York City, for example, has 10,000 sightings every single year on average. So it's a situation where the important thing is you're starting early, you're considering this early, you're implementing plans to stop it as early as possible, and that's what's important. And my congratulations to Peel for that. Next. Every rat biologist, wherever you go around the world, when you study rats are mammals, just like you and I, just like deer, just like the whales and the wolves. Mammals need food, right? So this is kindergarten simple, and I apologize, but for me, after studying rats over 25 years here in city environments, I don't know, I want this to be my epitaph, I think, is you walk by my gravestone, you'll see, I say no food, no rats. There's no mystery here, there's no secret. If there's rats in someone's yard, or if there's rats regularly seen on a block, or if there's rats seen in an alleyway of a city, downtown behind all the restaurants where the tourists are, they are finding rewards every single night. They must have food that's easily accessible. It must be nutritionally balanced. They need that just like we do. And it must be easy to get to, so they don't have to risk their lives being caught by predators and their enemies and this kind of thing. So when people see rats, sometimes they ask me, what's the best poison to use? What should I do? What trap, what poison? And I'm like, the best poison to use for rats is no food poison. That's what we want to think about first. We'll worry about the other things later. So that's the first thing I always explain to the public. Please, before thinking about what you're going to do, just ask, where is the food? Where it's usually within 30 meters of where you see rats, there's usually easily food. Next. So this is the scenario. Again, mammals. We have 8 pups here. They're healthy. The mom's healthy. Everybody's healthy. They're suckling on mom, as mammals do, for mammals being mammary glands and so forth. But that milk has to be nutritious. And to get nutritious milk for the mom, to provide for the offspring, they need proteins, they need carbohydrates, they need the essential minerals, and everything you and I need to eat healthy and balanced diet, they need the same thing. There's no difference here. This is why we study rats in laboratories for millions and millions of rats every year in laboratories. But to get that health, there has to be everything I just said in terms of food. If they don't have that food, they still can have some babies, but they may have 1 pup or 2 pups. And if the mother's under stress and not finding food, she abandons those 1 or 2 pups. The message here is, if there's no food, there's no rats. And if there's a little bit of food, there'll be a little bit of rats. And usually under stress, that will not live very long. Next. So this is the case in point. I was with the photographer, the very famous photographer, Charlie Hamilton James from National Geographic magazine. We were out foraging him out. He did a story on cities around the world and their rats, and we were out all night looking at our rats in New York City. But this is real. This is what we saw. This is a typical thing. And this applies to city litter baskets, city dumpsters. This applies to suburban backyards with somebody's trash cans on the side of the garage. It goes every place. In other words, these rats will smell, find their way to our garbage, and of course exploit it. As you see here, it just happens to be New York City's famous for pizza rat, you probably know, and so of course they love pizza. It's nutritional balance with, for high energy and fats and proteins in the cheeses and the bread and so forth and so on. So this is typical right here. While we're sleeping, this picture was taken in the middle of the night. Rats are active when we're sleeping, but this is what it's all about. If there was a cap on that litter basket and the litter basket was solid, they would be denied and would still be putting out our trash, except would be putting it out smartly. Next. Of course, every commercial establishment, we have to look at, if there's, let's just say, about 6,000 restaurants in the Peel region, there's 27,000 restaurants in the New York region, to give you an idea. But sometimes our restaurants are busy places, lots of work to be done, lots of food to be served, and always a lot of refuse left over. So, the commercial establishments, just like it's here, this is the back of a restaurant. It isn't New York. It isn't Mississauga. It's a different city, but it's the cities around the world. We all have the same principle. We have to get rid of our food waste. All those holes you see in those bags are from rats attacking those bags, ripping the food out, and then disappearing. I took this picture during the day on one of my surveys, and of course the rats, they're in their bed sleeping right now. But last night they were feeding at their dinner table. Right, so we have to do this right. If we don't do this right, we will have rats. Next. So, Peel asked me for my opinion and overview, and working with, the Peel specialists you just heard from, and Dr. Brandon and Anthony and several others. And I have to say, it's very impressive, the program being put together. The recommended program does the basic foundation of what you see right here. If we're to manage rats in Peel and start early, as you're doing, no exaggeration in my words here, everyone has a role. That's the only way this is going to happen. And so that's all with a capital A, all property owners, every single property owner, every store, shop, restaurant, the region of Peel itself as a city entity, and all the, councilors and everybody, the mayors and so forth. Critical. If we're going to get rid of rats and control them, everybody's got to be doing this partnership word that's so worn out. Of course, on the left side, you have to have experts that really know what they're doing if there's going to be any kind of extermination programs or surveys or managements. So you do need the IPM experts Anthony was talking about. You do need biologists that understand populations. And, you know, as Dr. Brandon was talking about, his 311 call does not directly reflect the number of rats. Surveys have to determine that. How many rats may be in a town is a difficult biological thing to put together. So, but all together, you know, within a recommended program, you know, that's the way you go. And I feel very confident that Peel is headed in that direction with the way they're thinking about things. Next. You know, this discussion and further discussion will be held on subsidy programs, as you just heard from Anthony Parenti. And, you know, these are good programs, but they must be put together just like the you know, management program, a subsidy program has to be put together very carefully. The details matter greatly. If they've not been put together, as you've heard, you know, they can be too expensive and abandoned, or they will be so weak that they're not really accomplishing much, except sounds good on paper. So a good subsidy program, you want to make sure you're hiring quality professionals. You want to make sure that, you know, there is that partnership that Anthony mentioned. Without that, your subsidy program is just going to appear on paper. That's all, as if, quote, we're doing something. So I have to say, you know, I believed in and looked at the program that Peel Region put together, and there too, I feel like they're doing it smart. Peel Region's doing this in a smart fashion, covering all the bases, as opposed to just handing out baits or traps, which many cities do, quite frankly. You sign up, you come in, you pick up your baits, you pick up your traps, you go away, we've helped you. Those usually fail miserably. Next. And finally, in my last two comments here, but it was stressed, you know, we're all about the environment, of course. We've learned that in some cases the hard way through pesticides. You know, we all know the story of DDT and what have you. And sadly, we are learning the same mistake again in many of the rodenticides, and a rodenticide being the rat poisons and mouse poisons. You know, that's a red-tailed hawk, and this picture was just taken a couple weeks ago by a photographer in Central Park. That hawk, of course, is going to feed on rats perhaps several times during the week. There's owls, there's coyotes, there's foxes, there's wildlife that if they are going to feed on the animals that we are just casually putting out poisons, we are going to kill that wildlife. And the published papers are coming in over the past 10 years that in fact is what is happening. The state of California just this week banned rodent poisons. The state of California. It was just signed by the governor. So it's a case of, do we have to manage rats because of the potential for public health issues and some other concerns and what have you? The answer is absolutely yes. But we have to do this environmentally smart. And environmentally smart, since the rats are depending on us for our garbage, is we are the answer, not poisons. We are the answer, and we can do our refuse correctly as cities and as partners and people in neighborhoods and community organizations. Shame on us if we can't do that. Okay, so the last slide, I'll just recap a comment here, if I could have my last slide. And you know, Anthony mentioned, but I want to stress, you know, I taught at Purdue University for 16 years on the staff, and I taught courses in IPM and rodent control and what have you, and my students had to know this code by the time they left, or they're not leaving my course. But 5 basic steps: you have to do surveys ongoing. There has to be staff assigned to doing rat surveys and doing them right so we get effective data. We have to keep our garbage tidy, and it has to be secure. We have to keep our buildings tight. When I drive through suburbia of my own town and areas for all my career, I notice most times I can see the light leaking from beneath people's garage doors and their main entry doors, meaning if you can see light leaking from the outside looking in, rats and mice can get in. And we can use non-chemical tools, traps and baits, of course, etc. Not the baits, the non-chemical tools of exclusion and the traps. And lastly, and very importantly, is then we can reach, when we need to, as a supplemental tool. There's nothing wrong with this, as long as it's done correctly with the environment concerned and applications that are going to be very carefully considered. But lastly, chemical can help out. In summary, chemicals are usually 20% of the tool, so not the first choice, the last choice, and only 20%. The other 80% is human beings acting smart in their own urban environments. Thank you.
Next slide, please. Thank you, Dr. Corrigan, for your assistance with our work. I won't repeat all the consistent stuff that is on this slide that Dr. Corrigan mentioned, but a key recommendation that we have to council should they consider such a program is the implementation of a strategy consistent with the IPM principles that Dr. Corrigan outlined in conjunction with a rebate strategy if one is elected to do so. It is important for council to recognize that even our local municipalities and conservation authorities have agreed with that general recommendation. Next slide, please. So in summary, staff and our consultants provide the following key recommendations for a successful rodent control program. A successful subsidy program would employ a cost-sharing principle to a yearly maximum amount. It would be implemented or limited to residential use only and would see residents receiving a subsidy for the use of an approved vendor. It would also include specific criteria for eligibility, as we mentioned, and it would focus on education and other methods first to eliminate pest nuisances. Next slide, please. I will now provide a brief summary of the estimated cost for the rodent control program. These costs include development and execution of the rodent control strategy using IPM processes, as Dr. Corrigan mentioned, including the development of a new internal team here at Peel. The data within this table is a summary of Appendix 3 that's actually in the report. It is important for council to recognize that these are high-level costing estimates only. They were derived by scaling program data from smaller municipalities to reflect Peel's population. They also include all items in the motion and represent more than just the cost for the subsidy program itself. Additional studies will be required to validate these figures in the future, and it is anticipated that these figures will vary year over year. Next slide, please. Thank you for your attention, and staff and our consultant are now available for questions should anybody have them.
Thank you very, very much for an excellent presentation. We have quite a list of questioners: Fonseca, Sato, Parrish, Downey, Vicente. Councillor Fonseca.
Thank you, Mr. Chair. I would like to say thank you very much, Anthony, to all staff for the immense amount of work that went in to putting together this report and gathering the data over the request for the deferral that Councillor Rass put forward. So over basically 2.5 weeks, you gathered all of this information in this presentation here with all the appendices. Do like to say thank you to Dr. Brandon, to Louise Oben, to Dr. Lowe, and Dr. Corrigan, if I may call you the Pied Piper of rats. Thank you for your taking the time with the your virtual, you attended in August at the recommendation of staff as well, the virtual community meeting that we had. Really appreciated that. And also for being here today. Just from a point of, I guess, to clerks, from a point of procedure, based on this report, I had put together and passed around, I guess, an amended or updated motion, which still keeps in principle the 3 recommendations that were in the my original motion that was tabled in September. Should I put that forward right now? I believe everybody has it. For discussion, or should we go through discussion first?
No, I prefer to have a motion before us, and I'm taking your motion as the first motion, Councillor Fonseca, so it's properly before us. Please proceed and speak to your motion.
So can everybody see it? I can't see it on the screen. It's the one that was distributed today.
And our technical people are just sorting that out so that it'll be on the screen.
Okay, so I will just briefly speak to it then and let everyone else ask questions to the deputants and then also make comments on the motion. But based on the report and in discussion with staff and what is presented in the report, My motion outlines, the motion before you outlines what Anthony, Dr. Brandon, Dr. Corrigan, and Dr. Lowe in a previous discussion have presented, and the importance of having an integrated pest management program in place, while at the same time implementing a pilot across the region of Peel to gather a pilot around a residential rodent control program with a rebate, as well as an integrated pest management control pilot for a period of 12 months. If you look at the motion, the motion and the budget covers off budgeting items that are in the report, save for a change to the, or as staff have recommended, save for a change to the actual rebate program itself. The number of 225,000 that I put in the motion for the actual rebate program considers 1,125 complaints across the region at $200 per rebate, rather than what the staff report considers. So the budgeting item in the staff report for a full region review considers 2,400 complaints at $200. So save for that, which Anthony pointed out, he's estimated. I think 1,125 complaints over a 12-month period across the region, considering that the number of rebates that, or sorry, the number of complaints that have been confirmed to date only through public health, not through other 311 departments or 211 departments. I think this budgeting number of 225,000 under the rebate portion and for a full year period would satisfy a 1-year pilot. I hope I'm explaining that okay, but anyway, I'll leave it at that for now. Yeah, I'll leave it at that, and interested to hear from other my other council colleagues and questions that they might have for staff or presenters. Thank you.
Thank you, Councillor Fonseca. Can I first call for a seconder for the motion? Councillor Parrish, I acknowledge. Councillor Parrish has seconded the motion. There you have it. Speakers to the motion or questions, comments, it's before the chair. Councillor Sado.
Yes, thank you, Mr. Chair. I have questions for the presenters. First of all, to Dr. Corrigan, thank you for the statement that it's important that we're addressing this while the numbers are still low. That's why we're very concerned and want something done now, because if we don't want to end up like New York City and others. So, are you aware of a study that was done? It was some years ago, but it was done in Europe, where they determined that Norway rats became reservoir hosts for Lyme disease through the tick population. And one of the concerns that we have here is that the number of ticks that are carrying Lyme disease are increasing. They are in Peel. We've had reports of people removing ticks, having them tested by their veterinarians or whatever from their animals, and found that they are the Lyme disease carrying ticks. So it is a concern. So I was reading this study that was done in Europe, and is that something that we should also be concerned about here? I would think of it if they carry it there, they're going to carry it here.
If the question is to me,
yes,
I'll respond. Dr. Brandon may also want to respond. I think I'm not familiar with that study. I would be a bit surprised if it's probably possible that they can get involved with the Lyme disease cycle. However, I would think that the ecological considerations of it being a high risk do not go together well. You know, I don't know what the environmental conditions of that particular study might have been, but since the Noi rats tend to be, in most cases, not associated in high numbers in woods and fields and trails and this kind of thing, but yet they constantly gravitate towards areas where, you know, the tick populations aren't out in grasses and plants and this kind of thing. I don't think there'll be much of a worry with Noi rats and Lyme disease, quite frankly. I think it would be experimental in most cases and possible in some areas, but I don't think very high in our city areas.
Okay, thank you. I just wanted a clarification of that because it was quite an interesting study to read on. And your other comment, I just want to comment on it that I totally agree with you that, you know, anything, and I think it's sort of a given that you don't just go out and do a rebate program. I don't think anyone ever suggested that, that you need a lot of education along with it. And I mean, that's just common sense. I think that you do that. To our staff, the issue, and Dr. Corrigan raised this, but perhaps someone from staff can respond. The issue of garbage. We get a lot of complaints about household garbage, which can contain food, which is dumped in our public bins. It can be in our parks, at our bus stops, which are regional responsibility for emptying. Our park staff are dealing with it a lot. It has probably been worse this summer. And it's interestingly enough because the number of complaints that I've been getting about rats this summer has been worse as well. So can you someone maybe respond as to how we can deal with that part of no food, no rats? I don't know who wants to deal with that one. It's a waste issue.
Through the chair, Councillor Sato, I'm happy to take a stab at that. We did work, Dr. Corrigan actually had a very detailed recommendation in some of his documentation to staff here for the region staff to work with city staff on a program specific for not only removal or more daily removal of waste in park settings, but also to replace receptacles with more pest control. And you can see even from Dr. Corrigan's presentation what happens when you don't. So that's something that we have certainly recommended in the report, that we need to have a more aggressive program for this because that could be or constituting some of the problems here.
Okay. And Dr. Corrigan, this may seem like a very, well, you deal with rats, so nothing. Are rats attracted to pet waste as food?
Absolutely. In fact, you know, the scooper laws that we have in our cities, you know, especially older dogs, when they expel their waste, a lot of that food that they ingest in the older dogs, they're very inefficient in how they digest that food. And so rats have learned that fresh dog waste often is highly nutritious. And not to be glib about it, but fresh dog waste is in fact in many ways a snack bar for rats. And so that there too is very important to have within a city environment, that there's, you know, pickup laws because, you know, dog waste will attract rats, it will reward rats, it will feed rats and other pests such as filth flies that then fly into our restaurants. So yes, dog waste is important.
Okay. And as we're educating residents, if they're picking up in their yards and storing dog waste in bins, for example, before it goes out for collection, does that attract the rats even if they can't get into the bins?
Usually the odors of foods, whether it be human waste and dog waste, those odors you smell, those are millions, if not billions of food molecules settling down to the ground and blowing along the ground. And animals like rats with their nose to the ground, that's how they find it. So does it attract them? The answer is yes. They will smell that emanating out of garbage cans, even with lids on them. However, once they get to that spot with the lid, with the dog waste in a good garbage can that they still can smell through the cracks and crevices, if there's no reward after spending energy of getting to it, trying to get to it, and failing to get to it, they're very smart animals. They learn, yep, smells good, but didn't pay off. And so they will go, and that's why I mentioned earlier, the food's got to be easily accessible.
Okay, so that's a good education for our residents for their own properties. I think that's an important one. To staff, looking at the cost, and I raised this last time, that the program that Windsor has put in place, which they employ or tender for the contractor, and it seemed to me that that would be a lower cost program than the subsidy program, but I also I would also feel it would be a safer program than having residents go and hire or even do their own, buy their own bait. Is the proposed program, because when I extrapolated the numbers from Windsor, looking at what they're spending in our population, it looks like the cost would be over an entire year would be under 1 million, where ours was significantly higher proposed. And it looked as if they use fewer staff as well because the contractor was going out and there weren't as many staff required for inspection. So would that, and I guess I'd like a comment on whether that would be also a safer way of doing it. Have you included in the rebate strategy that's in the report residents purchasing their own bait and traps?
Through the chair, Councillor Sato, that's a great question. We did look at this in great detail, the difference between the municipalities that had such programs. Windsor's is certainly unique in that it is a direct vendor extermination program on the basis of complaints. Theirs is also very established. To deem it necessarily safer, I will answer one of your latter questions first about did we consider a program whereby we'd fund that directly from residents? No, it is our belief and through Dr. Corrigan's recommendation that any rebate program would utilize pest control experts to do the work. And of course, there's legalities associated with staff or vendors working on private property. Henceforth, we recommended a program whereby staff would develop a pre-qualification roster of external vendors. So we'd get a real benefit of having a number of competing companies who would offer this service. Residents, we could even establish a program whereby we'd have a fixed cost. And then the residents would engage them directly for work on private property. It's tough question to answer on whether it would be safer one way or another. Windsor, of course, has the most experience, as you noted here, and their program has been in place a long time and probably very much matured as an economies of scale, working with just one direct inspector staff. So again, the range we provided from a financial standpoint is great considering the limited amount of time we had to really delve into the numbers here. So I hope that helps answer your question.
Okay. In the Windsor in the Windsor program, because it's been going on for so long, did you speak with the staff in Windsor to find out if by using the program as they have been, that they have been successful in reducing numbers or at least numbers of complaints through surveys?
Through the chair, Councillor, yes, we did. We had a very engaging conversation with Windsor staff. This is a big program of theirs. Their belief is that they have seen benefit in that, although the subsidy, like I said, the program has been in place a long time. And yes, they do feel that their programs are assisting in terms of overall reduction. But again, it's coupled with the concept of a team that works very much so on education, and not just the subsidy program itself.
Okay, and I mean, I think that's, as I mentioned earlier, I think that's a given. There was always that assumption. I know Councillor Fonseca and I have discussed that in depth. I'm very supportive of the motion to implement the subsidy immediately, and then go on to develop the IPM strategy. I think, having heard from Dr. Corrigan, I'm even more convinced that, you know, this is something we need to do now. It is a health concern, as I said before, saying that, and no offense to Dr. Brandon, but I said this at the last meeting, that, you know, saying that we haven't had a plague since 1939 is not a good statement in a year of COVID. You know, we all know that just because there hasn't been one in that length of time, that we're not going to get hit with it. And I've always believed in prevention over anything else. And I think from a health perspective, we need to show our citizens that we are prepared to support them in protecting their health from rat populations. That if we don't, they're just going to grow, and they're going to get worse, and we could end up having a plague. And God forbid, because we don't need anything else. 2020 has been bad enough. So I support it region-wide. Now, there is one thing in the motion that was in the previous motion and in previous discussion, is a grandfathering of the subsidy. And I don't see this in the motion. So are your numbers, Anthony, reflective of grandfathering? We tossed around a few dates at the last meeting. There was everything from June to July to August, September, whatever. Have you reflected grandfathering, and for how many months in your numbers?
Through the chair, thank you, Councillor. Yes, absolutely, we have. The report speaks to several assumptions that staff made in terms of developing numbers, and we did include the rebate portion back to June. We made some suggestions on how to strike the criteria for retroactive payments, because it would be a little bit tougher to do, given you know, we could have a wide range of criteria, and you can't really endorse or see the criteria currently in place if the subsidy is paid back to June. But we have carried an amount to make it retroactive to June of this year.
Okay, thank you. And you know, I agree with Councillor Fonseca that the numbers of complaints don't reflect the actual complaints that are out there, because many of them went to animal services. When I did my own little survey, I got a huge list of streets and from residents where they've had rat problems. Mine date back 10 years, Anthony, you know, to the stormwater replacement in my ward, which was very extensive. And that's really when the rat complaints started. And going back through my files, there are a lot of them there. But one resident put out their own bait, and they caught 100 rats on their property. And that's just, you know, the thought of it. My neighbor had his treated. He had them under his deck 3 years ago, and they eradicated them. And they said that when they do one location, it will basically eradicate the rats from the entire street. That I guess they're all were attracted to his yard, ate the bait, and it treated a larger area. So it's not that, you know, if you get 5 complaints from a street, you don't need to treat 5 different houses, 5 different households. So, you know, those numbers are going to be like there. But I know we found 2 of them ended up dead on my property, and it was certainly not a very pleasant sight to see. And I'd had no evidence of them at all. So, and none of the houses where they were in had any food outside, although we all have dogs. So we probably all had the dog waste in bins that was, that they were checking out. But they were very comfortable having their babies in the area. So, having seen it and hearing from residents, and I just can't imagine 100 rats on one property. So I'm fully supportive of it for the entire region for this year, going into next year, work on the strategy and bring it back. And I would hope that we would have support from all members of council on this.
Thank you. A couple of quick points of clarification. My apologies to Councillor Dasko. He was the original seconder of the motion, and I should carry on with him. So my apologies, Stephen, because you'd mentioned in the past with an additional policy to Councillor Parrish. And then for Stephen Van Offweg, and then back to Councillor Parrish. Stephen, you had a thought on what we've just mentioned?
Thank you, Chair. And I presume you're talking to this Stephen Van Offwegen as opposed to Stephen Dasko?
I've got Stephen Van Offwegen on my list. Go ahead.
Just for I just want to have some clarity on the intent of the proposed motion that's on the floor. When it speaks to proposed 2020 budget of $500,000, my sense would be that it's $500,000 for the full pilot of the program, as opposed to $500,000 in 2020 and then another budget in 2021. And if that's the case, I would just suggest that we remove 2020 and we put in the proposed pilot budget of $500,000, which gives us the flexibility to manage that program across 2020 and 2021. Thank you.
And I think I saw Councillor Dasko as the seconder and Councillor Fonseca nodding. They can reconfirm, but I think that's a good way to go as you've described. Councillor Parrish.
Well, just to even refine that a bit further, could we put up to 500,000? Because you may
Even
not
better.
get anywhere near that. Looking at some of the other costs, I'm also looking at Windsor. And Windsor's about a sixth our size, so you multiply their numbers by 6. It doesn't bring into I don't think they put in here their staff and all the research they've done and all the rest of it. I was going to ask Dr. Corrigan, he went by fairly quickly saying that rats are on the increase all over the world. Is this older cities replacing pipes? Is this climate change? Can you give me a couple of little examples of your thoughts on this?
Yes, there's a lot of factors, but the two you just mentioned are major players. These rats do not hibernate, they cannot hibernate, and as a result, when it comes to the cold winters, they traditionally shut down all reproduction, and they wait for the spring and a last reproduction in the fall. With the global climate change, the winters have been mild, as we all know. Mild enough to probably allow the rats to have one more litter on either end of the winter time that shuts them down. Since they grow logarithmically, and exponentially, if you will, but that one litter can add up dramatically when you do the math on an animal like the reproduction of a rat. So, we don't have empirical data yet on this, but it's highly suspect that the global climate change is affecting so many animals and mammals and birds and what have you. It's also affecting these populations in a negative way. So it's a situation too where there's other factors. We are replacing old sewers in cities, as you mentioned, and old sewers, rats don't infest just any old sewer. It has to be old sewers with bricks, certain flow rates, kind of things in certain areas where there's a lot of food flow and what have you. So some sewers, when you replace them, put them in modern sewer systems of monolithic pipes, you will chase rats down the street, down the city, into different areas. But we also have to keep in mind there's more people in our cities in general. The population in the last 20 years, and we have to look at 2 decades of data. There's more people, of course, there's more trash, and there's more sloppy trash, and 20% of most people in any city do not pay attention to the way they do their trash. That's what the rats are hoping for, that's what they depend on, and that's what they're getting, is those 20%. That's all they need.
Thank you. I know we've brought in the well-sealed garbage containers in the region of Peel, and that should be helping. I'm also wondering, Anthony, when you look at this whole project, if you look at a private tender system so that we do it like we do garbage, maybe one company for the part of the region and another company for the other part, and we can cut out all these private people that are being called in after this year's rebates. One of the sections that hasn't been addressed in this particular plan, which is very thorough, I was very impressed with Appendix 2, is the restaurants and grocery stores. If you go behind plazas, you can see stuff piled there that shouldn't be there. And I'm wondering if an element to this could be huge fines, not helping them get rid of their rats, but in fact, fining grocery stores and restaurants if they're not storing their garbage properly. It requires some inspection or maybe do it on a complaint basis. But if you put in huge fines there, it might pay for some of the costs of getting rid of the rats in private homes. And I am also very opposed to baits. The poisons will hit the birds and the squirrels and the rabbits, and it'll hit your pets, and it might even be picked up by kids. So that is one element of it that I hope we try to avoid at all costs. I'm happy to support the motion. Chris, you've done an amazing job on this. You've done a lot of work, and I really appreciate the work you've put into it. And I'm sure a year or two from now, the whole region will.
Thank you. Councillor Raz.
Thank you very much, Mr. Chair. Yeah, I got a few thanks here just to follow. Councillor Parrish have been going back and forth with Councillor Fonseca. She's done an inordinate amount of work and had some good conversations with staff as well. And thank you to staff for putting this together so quickly. We know that these are estimates at this point. I'm happy to support a pilot project. But I guess a few questions as we move through this. How are we going to be able to measure if we're successful?
Through the chair, Councillor, I guess I'll take a stab at that one. If you notice in the report, the staff recommendation, should this be employed, is that the IPM team will actively monitor and developing that program. A monitoring program is absolutely key to a successful program here. And I caution that any reduction in the budget amounts it's in the staff suggested report might impact what that IPM team is able to deliver in the context of a one-year program.
Okay, and is this going to be funded through our capital reserve program?
Through the chair, I might ask Commissioner of Finance to operate that, to answer that, but the capital component would be funded directly by the capital cost centers, and then the operating component from the stabilization reserves.
Okay. In order for people to be eligible for a subsidy, do they have to prove that all other methods did not work? Because as Dr. Corrigan said, that the extermination is method of last resort.
Through the chair, Councillor, absolutely. This is key to Dr. Corrigan's recommendation here that extermination should be a last resort. Extermination, although feasible, you establish that action threshold where extermination becomes the recommendation. And that's the key to that IPM process, that we need to study, address the problems, address the unkept areas. First and foremost, we need to develop that education piece. And then if unsuccessful, only then should we be implementing that program where you move to an extermination.
So what happens, for example, 3 of my neighbors, including myself, all have vegetable gardens, 2 have dogs, 1 has a bird feeder. Another neighbor has none of those things, but is the one experiencing a rat problem underneath her shed. How do you manage that?
Through the chair, I'm actually going to ask Dr. Corrigan to perhaps provide us some advice on that. I think his be very helpful.
Yeah, so even though those sound a little bit challenging, and they are a little bit challenging, there are ways, even with gardens and with pets, and with backyard compost piles and the things that can be conducive to attracting rats. There are, if you will, a kind of a drop-down box on each one of those is, here are ways to minimize gardens from being attacked by rats and minimize areas from rats getting into compost piles and so forth and so on. So each one of those there are steps, and I don't want to paint the picture like every single thing is covered and every single case can be solved. Sometimes there are greater challenges in certain yards and environments as to, well, you're going to have to do a little bit more perhaps than the neighbor that doesn't have the garden or the pets or the compost or what have you, and the certain types of bins. But I would say there's none of it is so difficult for anyone that it can't be done smartly and environmentally safe. Okay,
and I guess my last question to Dr. Corrigan, do you think that rats have gotten a bad rap all these years? I mean, we have the similar issues with chipmunks and squirrels, and red squirrels especially can do serious damage. But it seems like rats have got a bad rap.
Well, my life is to manage rat populations, but at the same time, I have to tell you, I admire rats. I respect rats. I've spent a lot of time living with rats in graduate school to learn about their behavior. But I agree with you that they have gotten a bad rap. The problem is once they build up their numbers and move in with us, now they deserve this bad rap because it's not just disease threat, it's they start chewing on wires and can burn buildings down and bring airplanes down and so forth. So they deserve some bad rap, but at the same time, we have to look in the mirror and say, well, what part of this do we share and blame?
Okay, thank you very much. This has been a very interesting education for us all. Thank you.
Thank you. A couple of commissioners, maybe with some clarity before I carry on. I see Commissioner Farr and then Van Offwegen on my list. Commissioner Farr?
Thank you very much, and through you, Mr. Chair. I'm happy to. I wanted to make some comments around the quantum of funds in the pilot being proposed. I'll make the comments now, and perhaps that will draw some more questions, and we can answer them as we go. I think we're okay with a pilot program and sort of working through that. I think that could be an interesting way to kick this off as a new sort of regional business line, and allow us time to both work with residents and work with council on how we would implement that, and certainly refine some of these numbers in sort of 2021, 22, 23. I really understand that concern that we don't want to get too far ahead of ourselves, and as Councillor Raz said, get a little bit of measurement going. But I certainly do have some concern, and I'm happy to have that discussion with council today, that if we set aside $225,000 or something in that quantum for a rebate program, as Councillor Fonseca said, that's 1,125 rebates we're going to have to figure out how to process. And I'm sure I have the same expectation of council. We want to do that well, we want to do that smoothly, and we want to do it, the ability to do it quickly. To do that, we're going to need some help to administer that from a staffing level. And the concern I have is the $198,000 that we've added for the second part of the pilot program to develop both the IPM program, have some staff out on the road working with residents on how they manage their waste, and definitely multi-res with big bins and things like that to make sure we improve that and really hit home on the no food, no rats. We're not left with a lot of horsepower left to develop all the policies we would need, and very quickly, to get a rebate program going, handle how we will work with residents on making sure their properties are inspected from our point of view, that we're spending this money wisely. So I just, and I'm quite happy to work with our staff and develop this a little bit over the next few minutes as the questions continue. But I just wanted to leave that point out there that the $500,000, while it seems like a lot of money to administer even a program like this, to do it properly, we need to make sure we resource it, because the staff working on it right now, as you've seen, and thank you very much for saying we've done a good job. We've really tried in the last 3 weeks. None of the people working on it, this is their core work. So we will have to find a way to eke out a few staff members to devote to this, and then backfill them within our businesses. So that's the challenge facing us. So I just want to put that out there, and then sort of work through that over the next little bit as we discuss the motion. Thank you.
Thank you, Stephen.
Yes, thank you. Through the chair, just provide a little bit of clarification to the question that Councillor Raz asked with respect to the funding. The pilot itself would be funded from rate stabilization reserves. Should the program prove successful, the bulk of the cost for the ongoing operations would be property tax funded. So I just want to make sure Council was aware of the ultimate funding source should the pilot program prove to be successful. Thank you.
Thank you. Councillor Kovac.
Thank you, and through you, Mr. Chair, I think the report obviously is very timely considering the motion that...
John, I'm losing you a little bit. John, can you hear me? We can't hear you now, and it's stuttering a bit as well. No, Councillor Kovac, it's just not working for the moment. Perhaps I can go to Councillor Dasko, and then I will immediately come right back to you. Councillor Dasko?
Thank you through the chair, and also I just wanted to thank you on catching that point of clarification with regards to the motion itself. And I've really got to give full credit to Councillor Fonseca to really working hard on this file, and you know, participating on the call that was held with residents. Well, not participating, quite frankly, I was a spectator as the call was going on. Very well done, and Dr. Corrigan has brought a whole other level of understanding to this real significant issue that I think has grown even more during our time of COVID now. But 2020, wow, talk about a biblical year. It's just been an absolute mess, quite frankly. I just have, I guess, a couple of quick questions. Is going through all of you know, through the report, etc., understanding that that the commercial component is separate, and that is something that is that's legislated, so that's not part of what we're looking at. We're looking at on the residential side. But as we're doing our full IPM program here, would it make sense as well that some kind of public service message goes out to the commercial component in case, you know, if some of them maybe are a little bit lazy or have forgotten or whatever, that we might be able to give them a bit of a nudge to say, hey, you know, this is on you guys too. So if we're able to do that, is that possible?
Through the chair, Councillor, it is a great question. I'll take a stab at it. Absolutely, a big part of this program and a big part of the dollars and capital required to roll it out is developing those education pieces and rolling out the program. There's no sense in doing this unless we engage everyone, and that includes the level of responsibility that we'd expect from our ICI partners and businesses here at Peel.
Thanks, Anthony. Much appreciated on that. And also, I would I would like to mention too. I couldn't agree more when it comes to the numbers that that Councillors Sato has brought up, and Fonseca, and Parrish, etc. Because I know that a lot of folks, when they see these rats, they're not quite sure what level of government to hit or who to talk to. So I do believe it comes through you know, the city quite often, or it'll be the region. And then also, you notice too on avenues such as Facebook and other social media platforms, people will talk about having them out there, and I don't know that they would necessarily get reported. So I think this is very timely, and I've got to say that I'm very supportive of this, and happy to second it, and hopefully we can have council also agree.
Thank you.
Thanks.
Councillor Kovac. John, you're up again. Let's try again. Councillor Kovac.
I'm going to try again, and if you could just let me know now after a few seconds if you can hear me okay.
Perfect. Carry on.
Does that sounds good. That's great. Well, I think we've all had our share of stories with rats. I'm sure we have, whether it's going back to when we were young or maybe in recent years. And I'd like to actually share a story with you about a few years ago when I came onto council. It was in that first year, 2015, and I was walking the neighborhood, as you would do, knocking on doors, talking with residents, and a lady who had come out onto her porch and was speaking with me shrieked in horror, and we looked down and it was a dead rat, I kid you not, about a foot. So it was more of a mature adult rat with the mouth sort of open, the teeth protruding outward. And so I had agreed to scoop it up and take care of it. I'm not going to share with you how I particularly took care of it, but later, about a year later, I was at Memorial Park and with former councillor Jim Tovey, and the lady and her family were there, and there was a large crowd. And then they pointed me out, and they said, "That's the guy who scooped up the rat and got rid of it for us." So it caused quite a scene, and former councillor Tovey has said, "John, what did you do?" It's interesting. I have residents within the Mississauga Valleys area, quite similar to Applewood Hills, the character of it, who report problems. One resident just last week told me 30 per month. He is, I imagine, using a bait box to take care of them. And I'll just say, I share some of the concerns that have been passed along. I'd hate to see damage done to what is a beautiful mammal, as Dr. Corrigan had referenced, and then the kind of domino negative effect that can happen through poisoning and other such forms. And I would sure hope residents are not going to be taking it upon themselves to be doing this kind of eradicating using this method. And the best that we can do through education as members of council and as the region to educate people and let them know to be clean and hygienic and take care of your yard and talk with your neighbor and do the best that you can collectively to reduce, I think, is the right way to go about it. Just in closing, and the question is to Dr. Corrigan, you, by any chance, just the other day, there was a CBC article titled, "For every rat you see, there are 10 more." Do you think that's just a case of embellishment?
I do think that's a little bit of embellishment. It's a very strong generalization I hear everywhere I go. For one you see, there's 10 more. For one you see, there's 100, and so forth. Every single case for when you see a rat is its own case. And so there are rats that in some cases it's the only rat they're going to see. And there are other cases, as you can imagine. Sometimes you see one rat, and if you go back at the right time, I guarantee you will see 75 more rats. So, but to just say that as a generalization of some kind of numerical rule never holds true. Biology is not that standard. There is no standard animal population, whatever the species.
Thank you for clarifying that, and thank you, Councillor Fonseca, for having brought this forward.
Thank you. I couldn't help but think Councillor Kovac's story was going to end it. And the next time I went by that woman's house where I picked up the rat, I saw my opponent's lawn sign, because it often goes like that. Well done, John. Councillor Paleshi.
Call the question, Mr. Chair.
Mr. Paleshi, if I may, I have one last speaker, Councillor Parrish. May I indulge Councillor Parrish with your permission? And I also have Dr. Lowe, I understand, wishes to speak.
Call the question, Mr. Chair.
Very well, I've been asked to call the question. Madam Clerk.
Thank you. All right, so this is a motion to call the question on the motion before council, and I'll just start. It doesn't require a recorded vote, but I will take a straw vote so that I can accurately record the names of council. Mayor Brown? Mayor Brown, is that in favor, Mayor Brown?
Yes.
Thank you. Councillor Carlson? No. Opposed? Mayor Crombie.
Now, I'm opposing this. I'd like to hear from Dr. Lowe and Councillor Parrish. Sorry.
Thank you. Councillor Demurla.
Yes.
Councillor Dasco.
I too think that they should be heard, but in the absence of that, yes, I'm in favor of it.
Is that in favor, Councillor Dasco? Yes.
I am in favor, but I just feel it's a shame that the question was called.
Okay, thank you.
Point of order, please. I'm not sure the councillors understand that they're voting to call the question rather than on the question. If Councillor Dasco wants Dr. Lowe to be heard, he should be voting against this, not in for it.
My apologies. I thought this was on the motion itself. So on calling the question, no.
Thank you. Thank you for that.
Second, Councillor Demurla as well.
Okay.
Yeah.
So perhaps what I'll do is I'll start again. And this is the motion to call the question on 10.1. So we're voting on the motion to call.
I stand down the calling of the question.
Okay.
Councillor Paleshi, thank you. I'm going to go to Dr. Lowe, then Councillor Parrish. Dr. Lowe.
Thank you so much for the opportunity. So through you, Mr. Chair, just to Councillor Dasco's question, in respect of commercial premises, health protection inspectors in public health do also continue to do regulatory compliance checks with food premises and will levy fines if rodent control is not put in place in accordance with the Health Protection and Promotion Act, rather the Ontario regulations within the Health Protection and Promotion Act requirements. So that will also be a component of a continuing component of our strategy to address rodents in our community.
Thank you. Councillor Parrish, last word to you.
I'm not going to speak. I just wanted to ask a question. I can remember when I was in Ottawa, the rebate checks, we were also told, and this was years ago, that every check you mailed out cost $25 to process. Is it possible that the rebates for the pest control can be just deducted from their tax bill?
Councillor Parrish, why don't we refer that whole process to staff? If somebody can answer now, that'd be great, but you raise a very good point that might be worth looking into. Unless somebody can answer me now. Stephen, Commissioner Van Opwegen, any thoughts on that? A rebate program on taxes as opposed to the paperwork of, I've heard the same statistic,
Yeah.
It costs money processing a check as government.
Well,
Something we,
Sorry,
Go ahead,
thank you,
Stephen.
Mr. Chair. My first observation would be is that the region doesn't do the tax collection. That would involve the local municipalities, and this would be a regional program, so that may be an obstacle, but it's certainly something that we could explore through the pilot program and implementation with the local municipalities, but that may prove more problematic as that may require separate motions at each of the 3 local municipalities for that to occur.
Thank you.
Thank you. With that, that is my list. I now have the motion before me as moved by Councillor Fonseca and seconded by Councillor Dasco. Madam Clerk, the vote to you.
Thank you, Mr. Chair. I will give the motion a short reading with council was okay with that. Thank you.
Move a short reading as was done by Councillor Downey and Councillor Parrish. Any opposed? None? Call the vote, please.
Therefore, be it resolved that the Pest Control Subsidy Framework and Study as described in the report of the Interim Commissioner of Public Works and the Acting Commissioner of Health Services titled Pest Control Subsidy Framework and Study.
Sorry, could you speak a little louder? I'm having difficulty hearing you.
Absolutely. Therefore, be it resolved that the Pest Control Subsidy Framework and Study as described in the report of the Interim Commissioner of Public Works and the Acting Commissioner of Health Services titled Pest Control Subsidy Framework and Study listed as item 10.1 on the October 8th, 2020 Regional Council agenda be approved with the following exceptions. The full region rebate program be piloted for 12 months. Peel implement an interim subsidy program by providing 50% of the incurred cost for the services of a registered professional pest control service to a maximum of $200 per property per year with appropriate invoices submitted for a proposed pilot budget of up to $500,000. Effective immediately, the rebate program, full region, $225,000. IPM resources and waste management support, $198,000. Construction abatement program, $75,000. And further, that staff monitor the issue and report back on the full region rebate program and pilot project in October 2021 prior to implementation of the program beyond the initial pilot stage. And further, that the capital abatement programs be funded by capital cost centers, and further, that the pilot be funded through the rate stabilization reserves until the program can be evaluated after the initial pilot stage. And this requires a recorded vote. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson? Yes. Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey? Councillor Downey in favor. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes, in favor.
Councillor Groves in favor. Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
In favor, yes.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes, congratulations, Chris.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
No.
Councillor Paleshi opposed. Councillor Parrish? Yes. Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor?
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Councillor Early?
Yes, in favor.
Councillor Early in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor, and that carries.
Thank you. Very well done, staff. Thank you, Dr. Corrigan, and very, very, very well done, Councillor Fonseca. That brings me all the way down to item 21, other business and councillor
Speaker?
inquiries.
I'm sorry, Mr. Chair. I'm just wondering if this is one of those occasions where, as we talked about at policy, that we send out a really spectacular press release.
Absolutely, yeah. I
And
think that makes a
giving
lot of sense.
due credit to the mover of the motion.
Here, here. Well done, and the chair will ensure that that gets done. Thank you, Councillor Parrish. Are there any other business items or councillor inquiries? Seeing none, Madam Clerk, I come to you because that brings us to the one in-camera matter, 24-4. So if you could properly take us into in-camera.
Thank you. Motion moved by Councillor Sinclair and seconded by Councillor Carlson that council proceed in camera to consider reports related to the following. Item 24.4, proposed property acquisition, Town of Caledon, Ward 4. Are there any objections? Hearing none, that carries.
So if the clerk and the staff can ensure we're properly into in-camera and advise the chair when we're good to go. Okay.
Moved by Councillor Sinclair and seconded by Councillor Paleshi, that the direction given in camera to the Interim Commissioner of Public Works and the Regional Solicitor related to item 24.4 listed on the October 8th, 2020 Regional Council meeting agenda be approved and voted upon in accordance with Section 239(6)B of the Municipal Act 2001 as amended. And this does require a recorded vote. Mayor Brown.
Yes.
Councillor Carlson. Mayor Crombie.
Yes.
Councillor Demurla.
Yes.
Councillor Dasco.
Yes.
Councillor Dillon.
Yes.
Councillor Downey.
No.
Councillor Fonseca.
Yes.
Councillor Fortini. Councillor Fortini.
Yes.
Thank you. Councillor Groves.
Yes.
Councillor Innes.
No.
Councillor Kovac.
Yes.
Councillor Mahoney.
Yes.
Councillor McFadden.
Yes.
Councillor Medeiros.
Yes.
Councillor Paleshi.
Yes.
Councillor Parrish. Councillor Raz.
Yep.
Councillor Sato.
Yes.
Councillor Santos.
Yes.
Councillor Sinclair.
Yes.
Councillor Starr.
Yes.
Councillor Early.
No.
Councillor Vicente.
Yes.
And that carries.
That carries. Madam Clerk, next. I have a motion moved by Councillor Downey, seconded by Councillor Fonseca, that bylaw 62-2020 to confirm the proceedings of Regional Council at its meeting held on October 8, 2020, and to authorize the execution of documents in accordance with the Region of Peel bylaws related thereto, be given the required number of readings, taken as read, signed by the Regional Chair and the Deputy Regional Clerk, and the corporate seal be affixed thereto. All those in favor? None opposed. That is carried. And I have a motion moved by Councillor Kovac, seconded by Councillor Vicente, that the October 8, 2020 Regional Council meeting be adjourned. All those in favor? Any opposed? That is carried. Thank you to all.